Conversations. This is a community conversation. You know, community problems sure do need community solutions. So we're grateful you're all here. And many of you I know have been doing a lot of great work behind this. So first of all, I want to introduce I'm Kimber Gall, I'm your mayor, and this is part of our mayor's initiative. But first I'd like to introduce our panel. So over here, first of all, we have Tom Nash, and Tom Nash is a local social worker who's been in the field for a long time, and he'll tell you more about himself. We have Thomas Steenblock from Mobile Medical, Humboldt Open Door. Kristen Freeman, who is the director of the Women's Side at the Rescue Mission. Commander LaFrance, who was the person who started the CSEP program, Community Safety Engagement Program with EPD. And then we have City Manager Miles Slattery, who's been involved and engaged since the beginning of time. Actually, he was very what's the word I'm looking for? He was really engaged with the process of Uplift Eureka and the CAPE program and those kinds of things, but they'll all tell you about themselves in just a few minutes here. And so with that, again, I want to just share my appreciation for all of you that have come out. We really appreciate that you're here and that we can have this conversation, and hopefully you'll feel better when you leave than you did when you got here. So with that, we'll turn it over to Jacob Rosen, who will give you the information about decorum and how this meeting will be run.
Hey there, everyone. My name's Jacob. I'm the managing mental health clinician for Crisis Alternative Response of Eureka, the city's mental health program. Wanted to go over a couple things today before we get started. First, I just kind of want to acknowledge the awkwardness of the room, and that, you know, we're doing a town hall, but there's like a bunch of barriers between the panel and the folks who are asking questions. We definitely recognize that. We'd like to make it more informal, but this is the most convenient area that we have to kind of be able to televise it and stream it so that we can expand the audience. So bear with us on that, using the podium and kind of the formalness of the setting. You may not agree with everything you hear from everyone here today, but please remember that, you know, everyone here is your fellow community members, and we want to be respectful both of their time, but also their, you know, opinions and beliefs. You know, our goal here today is to have a respectful conversation, and so we'd like to be able to make that a safe space. So keep that in mind as folks are coming up and asking questions or having comments. There are two ways to ask questions. When we get started on the Q&A part, first we will have people come up on the left side here, and they can come up to the podium and then ask questions that way. The other way is you'll see on the other side of the room there are some note cards in a basket. If you don't feel comfortable coming up and standing in front of the podium and asking a question to folks directly, you're welcome to go and write down your question on that note card. If you want to put your name, you can. If you want to be anonymous, that's fine too. And then if you want a specific panelist to answer the question, just make sure you write their name in the top right corner, and we'll make sure to address it to them. Last time we ran out of time and didn't get to a lot of those written questions, so we're going to try and alternate verbal at the podium and written questions back and forth this time, so we'll try and get those addressed a little bit more. I think that pretty much covers it. There are still tacos down at the end of the hall, so if you'd like to get some food, feel free to go and grab that. There's also water down there. Restrooms are along the left side of the hallway as you turn right and go. They'll be on the left. So if you need to use the restroom, by all means, we'll kind of keep things flowing as time goes. So, you know, we'll be here for about 3 hours. Feel free to get up and get food or use the restroom as you need to. So with that, I will kick things over to our panel, and we'll do some brief introductions, and then we'll start the Q&A. Thank you. Start. Thank you.
Hello. My name is Tom Nash, and I am a mental health clinician employed with Humboldt County Department of Behavioral Health. And for 13 years, the first 13 years of my career, I did homeless services. I started working with street outreach services way back in like 2007, and since then I worked with the home program and mobile outreach program. There are different versions of county's homelessness outreach services, and the last 2 years I've been doing crisis work, so I'm not really involved with homeless services anymore. So don't misconstrue anything I have to say as official county policy, because I'm not really involved with homeless services anymore. So I'm 66 years old, and I'm just a few weeks away from retirement. I moved to Humboldt County in 1977, and I experienced homelessness twice in my life. For 3 months, I lived in a homeless shelter, and for 2 years, I lived out of a vehicle. My homelessness was largely driven by addiction issues. I think that homelessness used to be a little more fluid. It was easier to kind of drift in and out of homelessness. Nowadays, it seems like it's much more persistent and chronic, and there's fewer natural off-ramps out of homelessness. Many of the drivers of homelessness are large systemic problems that are largely beyond the control, our local control. So housing costs are skyrocketing, and that holds true for purchasing, renting, leasing, building. Anything to do with housing is getting really expensive. And when rents go up, it's the most marginal people who are going to be squeezed out of housing first. And then there's the supply of housing. We're doing a lot of great work as a community. Keep up the good work. We need lots of affordable housing. I don't think we're going to be able to build our way out of this housing crisis anytime soon. And when the inventories are low, then the marginal people are the people that get passed over first. You know, if there's 15 people applying for a vacant apartment, it's the homeless guy is not going to get is not going to be able to get approved typically. And then for a subset of the homeless community, addiction plays a major role. And that, I think, our community is just flooded with really cheap meth and really cheap fentanyl. And that's a national problem that it's pretty intractable. It's just a terrible problem. It's affecting our community in many ways. And then it's well known that addiction is usually fueled by the more serious cases of addiction are usually rooted in childhood trauma. And the research will verify that, and my experience, I've seen that to be the case. And as a society, we do care deeply about trying to alleviate the harm from child abuse until the children turn 18, and then we don't do such a good job after that. And those trend lines for the drivers of homelessness are not going in a good direction. I've seen a number of 5-year plans to end homelessness come and go during my career, and yet homelessness remains. As far as addiction interventions, we do a pretty good job as a community providing all different kinds of addiction resources. We're not quite at treatment on demand, but we're not far away. We're pretty good with that, I think. And anyhow, what can we do to try and help homelessness, try and improve the situation? Well, I think we need to keep doing what we're doing. The county mostly has a philosophy called Housing First, which basically is trying to put as many homeless people into housing as possible, and then providing services to try and support their ability to succeed in housing. It is fairly expensive to house people, but it's even more expensive to not house them. And probably Thomas will tell you about this, that the medical costs related to people who are trying to live outdoors become very, very, very expensive. But we need to be clear-eyed that homelessness is a very stubborn problem that's going to persist, and it may even get worse. in my view, we need to do more. We should embrace safe camping, safe parking, tiny house villages. I know these are stopgap measures, but they can have a meaningful impact on the lives of people who are experiencing homelessness while simultaneously reducing the harmful impacts on our community. Homelessness is toxic to human beings. The cumulative toll of homelessness on the physical and mental health of homeless people is severe and profound. And I think it's just inhumane not to seek timely and effective solutions to mitigate this harm. Thank you.
Tom. Thank you, Tom.
Thank you, Tom. And I'm Thomas Steenblock, and I am the Administrative Site Director for Mobile Health Services, which is one of the divisions of Open Door Community Health Centers here in Humboldt County. And to tell you a little about myself, in fact, I used to do training for all new providers and staff at Open Door, and I would tell them a little bit about me. And one of the things about me is, of course, I do have a history of addiction, and I've also been homeless. And when I came to the end of that trail, it was a 27-year-long trail. I didn't learn that behavior at home, by the way. I come from a really nice, kind, loving family who believed in me, and I wasn't buying into any of that, and I went my own way. And when I came to the end and I finally found my way into recovery, I found myself being profoundly grateful. What was I grateful for? Was I grateful that I wasn't in prison? Absolutely. You know, I got a lot of friends who are in prison. Was I grateful I wasn't dead? Yes. I know a lot of people who died doing exactly what I did. But what I was really grateful for, the thing that made all the difference in the world, was I looked backwards and I realized that during all those years, often when I was way less than deserving and certainly not looking for it, people did kind things for me. People were kind. People were helpful. I think about the entities in this community that helped me at the time: St. Vincent de Paul, Department of Health and Human Services, Open Door Community Health Centers, and many others, including people in law enforcement, people in other places and healthcare who constantly gave back to me. And I found myself wanting to do something like that. I'd always been a laborer. I hadn't graduated beyond high school and trying to figure out what to do. And my wife, who I was lucky was still with me, happened to have seen an ad on TV for medical assisting. And I thought, well, that's cool. I can probably learn how to use a stethoscope and write stuff in a chart, which shows I know how much I knew about the job. And I went, and I was mildly trustworthy. So somebody loaned me money to go to school, and I went and did that. And I went to do my externship rotation at Humboldt Open Door Clinic in Arcata. And I really wanted to do it somewhere else. I was really into being I wanted to be a provider one day. And they said, but I couldn't get in with the specialists, and they sent me there. And I thought, cool, people with colds and kids with head lice, fine, I can go, do my time and learn what they have to offer. And I went there, and I was totally blown away. Every person I met, the people who worked at the front desk, the medical assistants, the providers, the administrators, the counselors, the billers who still worked upstairs, everybody who I met there, everybody went to the mat for everyone who came in the door. And it didn't matter what you looked like, and it didn't matter what you smelled like, and it didn't matter how much money you had, or if you were gay or straight or man or a woman or black or white or what. It didn't even matter if you acted the way that you really should act with your fellow human beings. They did everything they could to meet people where they were at in life, to give them a sense of their own worth and dignity, and to try to help them find a healthy path forward to greater happiness and fulfillment. And I saw them, and I suddenly knew why I wanted to be in healthcare, and it was to be like them. I got into healthcare because I thought I was interested in science and medicine, but it turned out what I'm really interested in is social justice, in the way that we treat our fellow human beings. And in the 17 years that I've been there, I've gotten to see that way of treating people is not just something that those folks at that one particular location do. It is really kind of the heart of what Open Door is there for. We are there to serve our fellows. That is our whole purpose. A few years ago, they asked our executive team to sum up our mission in like one sentence. And what they said, and what keeps me coming back to this work, is that Open Door exists to level the playing field of human dignity. And so healthcare is the means that I've discovered through which we can do that. It is one of the ways among many that we're able to bring people together with that. And Tom summed up a lot of the challenges that we see. I've been very fortunate over the years. I started as a medical assistant. Open Door saw more in me, and over time I've had the opportunity to work in our central operations to help build up what we do at multiple locations as we added clinics. When I joined Open Door, there was less than 300 employees. We now have over 800, almost 900 right now. But Open Door has had me represent them at both our local HUD-funded continuum of care, the Humboldt Housing and Homeless Coalition, as well as nationally and at the state level with our interests in serving those who are without housing. And one of the things that I've seen is that the pattern that we're seeing in our community is not unique to us. It is everywhere. I have talked to people from every state, in every part of California, and particularly in the rural settings. Homelessness is a growing challenge for our country, and we're seeing it locally played out here in a place that's already resource challenged and pretty cut off. And so together it's going to take the community as a whole to address this. And it really is true. We have a refrain that we say, which is that housing is healthcare. You cannot maintain your health if you don't do the right thing around housing. And one of the reasons that that's so important for everybody, whether you're housed or not, is there's a reason that American healthcare is so expensive, and this is not a political reason by any means. It's a very simple thing. The most expensive form of care on planet Earth, anywhere in the world, is the American emergency room. That is the most expensive form of care. And when people use it, whether they have coverage or not, it drives up the cost of healthcare everywhere else. And so when we can work with people who are short of housing to help give them resources to keep them out of the emergency room, to help them ahead of those incidents, it changes the game for everyone. It makes it possible to have healthcare in the future for everyone. So it's a big deal. And like if you're diabetic and you're out walking on the street, okay, and you need insulin, well, guess what? Insulin has to stay cold. It needs to be in a refrigerator. Otherwise, it's no good in a couple hours. You can't maintain your insulin by yourself on the street without a refrigerator. It's very hard to maintain your pills if your stuff disappears, and all of those things. And those are contributing factors, not to mention if you get a wound, healing, you need to have food. You need to have a clean, dry place. You need to be able to have ways to take care of yourself. And for those of us who are housed, we have that. We often have housing, we have resources, we have family, we have friends, we have people who support us, we have coworkers. And that's a different challenge for those who are unhoused. It doesn't mean they have no resources, but their resources are different, their access to them is different, and they don't have many of the things that we count on. So Open Door is really committed to trying to help be part of the solution to that, and working with all of our community partners, which is really all of you, every citizen of this area, to try to help create that. We see the largest version of this challenge right here in Eureka. And the statistics support that, the numbers support that, the point in time counts support that. And so this is the place where we also are the place that has the opportunity to create real solutions that are meaningful in our local setting, with our local resources and context, and with what we can draw down. So I'm very grateful to all of you for a chance to be here today and to share, what I know and experience working with this. And thank you for all you do. I see lots of faces out there that I see all the time in this conversation, constantly carrying the work forward, and I'm grateful to you all. Thanks.
Thank you.
Hi, everyone. It's an honor to be here today. My name is Kristen Freeman. I'm the director at the Eureka Rescue Mission Women's and Children's Shelter. I came to Eureka in February of 2015 from South Carolina. I left behind 19 years of active addiction, 17 years of homelessness, 13 years of human trafficking, my 2 sons, and my family. My mom, my sister, and my 3 daughters already lived in Humboldt for about 5.5 years. I came here looking for a fresh start and a new beginning in life. I had been the town terror for almost 2 decades, in and out of jail. I had lost custody of all 5 of my kids through the court system. And to the community, I was just a lost cause. I was hopeless and I was homeless. I was looking for a hand up and no longer a handout. I was tired. I wound up at the women's shelter as a single guest. Upon entrance, I was able to secure stability, landed a job at Taco Bell. I started having regular visits with my 3 daughters. And not too long after that, my oldest daughter came to stay with me at the shelter. So one by one, I regained custody of my daughters. The mission accommodated my family as we grew. I immediately began seeking out mental health services through my primary care doctor, which is through Open Door, knowing that if I didn't, I would end up in a full-on relapse. I followed all the rules of the facility, diligently saved over the 75% of the required income savings, and after a few months, I had enough money to start looking for a place to live. That's where the real problems began. It was challenge after challenge, denial after denial. I faithfully searched for housing for myself and my children, put in over 30 applications, and was turned down on every single one. I had heard so many different reasons as to why they went with someone else. But the bottom line was I have an extensive criminal background, no rental history, and did not make 3 times the monthly rent. It felt like my past was going to hold me hostage forever. I couldn't go on the wait lists for public housing or Section 8 because of my past charges. As a single mom living in a shelter, it's next to impossible to work more than one job to make 3 times the monthly rent. The kids can't be left alone in the facility. There's no daycare for evening shifts. And my mom was struggling with her own housing situations and mental health struggles. So I didn't have much of a support system except for the community. I searched for permanent housing for over 7 months before I was finally secured in renting through a private owner. By then, I was able to buy a car and had learned how to manage a budget while living at the shelter. I have sobriety for 8.5 years and permanent housing for over 7.5. Thank you. It doesn't mean that I don't fear homelessness every single day. I live under somebody else's roof, paying somebody else's mortgage, and at any very given moment with the month-to-month lease, they can give me a 30 days notice. So it's still a fear that I have, and probably will until I become a homeowner myself. I feel personally that the lack of a strong mental health system here and wraparound services are factors in the homeless epidemic here in Humboldt. Not everyone fits into communal living. They won't leave their animals to come in for shelter. And where I come from, I experienced personally a dual diagnosis facility that had the capability of dealing with both mental illness and substance abuse. And where I come from, I did not realize what homelessness was. Even though I was homeless, I didn't realize that people literally sleep out on the streets. Like when I came here, it was a shock to see tents on sidewalks and stuff. It was definitely a shock. So at the shelter, we offer community outreach showers 7 days a week from 9 until 2. We have a free clothing closet that also offers interview clothing for people who are trying to obtain jobs. We offer meal services and overnight shelter and require the guests to save 75% of their income for future housing opportunities. If guests don't have IDs, then I have a free ID voucher as well as free birth certificate vouchers for people born in California. And I have a motto, since I am a success story from the Eureka Rescue Mission, I have a motto at the shelter, which is we are a stable foundation on which to rebuild. Use us, don't abuse us, and you will succeed. Like I said, it was really shocking to come here and see what homelessness actually looked like, because where I came from, I always pretty much had somewhere to stay. Motels are $25 a night out there. Out here, there's not even affordable motels, even the ones that have bugs. They're not affordable. People won't leave their animals to come in for shelter, and the shelter cannot accommodate emotional support animals, only medical service animals. So that's another big thing that I think plays a part in the homelessness, as well as addiction. But to be honest, living with mental health issues myself and living in past homelessness, you can't really help the addict until you help the mental health issues. And that's something that I learned. Anytime my mental health was untreated, I always went back to using. So that's why I think that a dual diagnosis facility is very important to have, where they can treat not only the mental health, but also the addiction side of it. And thank you for having me here.
Hey, good afternoon, everybody. I'm Leonard LaFrance. I'm one of the commanders at Eureka Police Department. I've been with Eureka Police for about 17 years-ish. About 6 years ago, I was asked to take over, or actually to develop a specialized team that would focus on issues in Old Town and along the Waterfront Trail. We decided to call the team CSET, or Community Safety. At that time was Community Safety Enhancement Team. Yeah, enhancement. Then eventually we switched over to engagement, which was much more appropriate. This team really blossomed from a team that focused on just quality life issues, just crime, disorder, trash, etc. in those areas, to really more of a street outreach team with the officers we had on that at that point, and also to a mental health response team. So currently the team at one point had 5 officers on it. We had a sergeant, which was myself. We had 4 officers, a mental health officer, an Old Town officer, 2 park rangers that would patrol the trail 7 days a week. Obviously with staffing, we're down to 3 officers now, and then we have 2 support staff, professional staff as well with that team. That team is, CSET is embedded every day with our homeless community. They know most of our folks by name. Most of the folks on the streets, they have our cell phone numbers. They can call us directly if we want to connect with services, or if somehow we can fill a gap. Can't really describe what they do because there's really no limit. For example, with Kristen, we had to get a car seat for a kid, and so we just drove to Target and got Kristen a car seat for a family that needed one. But they really fill the gap in the community. There's a lot of gaps that we see. The big thing for us is the system is very challenging at times. Social services, mental health, all the systems to actually process through those. It takes a lot, and so often we can streamline. The fact that we have a platform of being police officers, once we show up at a meeting or with somebody for some reason being in uniform or having a badge and a gun, gives us a little bit better platform to actually get things done quicker. And so we're usually able to get people directly to services and or make it go quicker for them if needed. Most of the work for CSET is about personal relationships. So you know the people that are on the streets. You also know the community partners as well. Like I know all these 3 very well, work with them quite a bit. And that's the key for everything is I know who to call if I have an issue. If they don't know, then they know, hey, let's call this person. But it's also knowing the people on the street, knowing when someone's escalating, being available, and in that moment when someone's ready to either go to rehab center or housing or back to family, we're able to get them back, which is beyond important. And then of course there's the accountability piece. A lot of the behavior you'll see with our part of our community, our homeless community. And I would it's probably a small percentage causing a lot of problems. But again, we have to have an accountability piece because without accountability, we have chaos. And I can easily show you some data points on that where we've seen just no accountability at all, just chaos ensued and calls for service are through the roof. And then the exact opposite when we're actually doing engagement with folks and accountability measures and seeing those calls for service go down and the impact for the community go down as well. Every 2 years, we also do a homeless survey between CSET, Uplift, which is technically houses our outreach workers, and then it'll be CARE in the future. So we do, technically. I don't know, Miles. Miles is our comedian, by the way. So we do a homeless survey every 2 years. We ask 38 questions. We have a bunch of data points on that. We've put it out there several city council meetings. We did one last in 2022. We'll be doing one in 2024. And we actually got a lot of data points from our community. So it's interesting to see the numbers of the people we survey and also the responses we get, which give us some good correlations to why people are on the streets. There's some correlations to homelessness in our community. So yeah, it's been an interesting past 5-6 years doing this work. It's not what I expected when I entered law enforcement, but it's definitely needed. And we definitely have law enforcement has a place at the table. We should not be the primary folks to deal with this issue overall. But again, we can't be so naive to believe that we can just completely let law enforcement out of the picture because there are definitely accountability issues. And I think my counterparts would agree with that as well, that we have a place or a piece to play in this as well. So I will hand it over to city manager.
Thank you, Lenny. I'm Miles Slattery. I'm the Eureka City Manager. I'm Miles Slattery. I'm the Eureka City Manager. I've been also here for approximately 17 years, a little bit over 17 years. Prior to this position I'm in now, I was a department head for community services. Back in 2013, I became the department head. Right after that, we were dealing with a lot of disadvantaged children in our programming, from summer camps to athletics to all those things. And we had a previous employee named Brian Millett who came from back east, had a familiarity with doing kind of social service programming. And so we took the initiative on establishing kind of a social service program, kind of one of your kind, definitely in this area, if not in California, where we started social services mainly concentrating on disadvantaged children. We went out, held fundraisers, was fully funded through donations from local businesses and local community members, providing opportunities for disadvantaged children to come to our camps, to come to our rec programming, as they didn't have access to that. That eventually morphed into, Uplift. And by the way, it was a community access program for Eureka is what the program was called. That eventually morphed into Uplift, which kind of went into taking care of some of the disadvantaged community members that are adults in our community. We have significantly expanded that, the success of it. It was actually funny because DHHS, when we first started this, were extremely skeptical and did not have much support. And after a few years, we wouldn't be in existence if it wasn't for DHHS. They provided outstanding grant opportunities for us and the ability to fund housing, the ability to fund our Pathway to Payday program, basically a lot of our programs that wouldn't be as successful if it wasn't for the support of DHHS. So I just want to make that clear. Because of the success of it, we still take donations, still do a lot of grant writing, and vast majority of our funding comes from grants. But now it's actually a program within our general fund. Eureka's tax dollars go towards supporting this program. We've recently expanded that to include a mental health response. I would say we had been planning on doing that for a very long time, but COVID really brought it home on how significant, I think Thomas was talking about this, the impacts on our emergency room and the impacts on our EPD, on everything with that when we were going through COVID, having the mental health issues on top of the COVID issues, what it did to our ER, and made us realize that we needed to do better. And so we went out and hired Jacob, started the alternative response team so that we can go meet people where they're at, prevent them from going into those services that are costing the amount of money that we discussed about previously. We intend on expanding that to include a medical component because we know that a good portions of the times when we're dealing, especially with the community members experiencing homeless, they also have physical issues as well. And so the intent is to expand that, to have it so that it's EPD only when necessary. And we've worked with our dispatch. Fortunately, we have our own dispatch. We've worked with them on practices to make sure that we know when to just send mental health response or to spend a combination of both EPD and the city. But I can say that, when we first started the program, we had the issues behind the mall at Palco Marsh, learned a lot about things that didn't work and realized that we needed to do things differently. We have been extremely supportive of any sort of housing options. We were critical in setting up the Blue Angel Village, helped with the expansions of Eureka Rescue Mission, created an emergency overflow shelter with St. Vinny's. This year we have the warming centers that'll be in addition to that, with their barrier-free. And we plan on looking at hopefully a home key grant to expand our shelter space to deal with some of the issues that Kristen was talking about as far as barriers that folks have with either couples or dogs, so that we can have shelter space that doesn't have those barriers. But I'm happy to be here, and thank you for having me, Jacob.
Thank you, everyone. One sec. Before we get started with the Q&A, I had forgotten a couple things earlier. One, I'd like to thank NAMI and the Hope Center for tabling. They're outside here and they have a bunch of resources. And so, if you're taking a break or afterward, if you want to check out their resources, talk with Leah from NAMI or Betty and her staff from the Hope Center, they are there and they support our community and they do a tremendous job. So thank you very much. I'd also like to give a shout out to Esmeralda's 2.0. They supplied our tacos today. And then I'd also like to thank the Flower Boutique who supplied us with the beautiful arrangements up front here. So without further ado, I'd like to kick things off with a written in question that has kind of a follow-up, and this will just be to the panel in general. The first part of the question is, what makes homelessness the problem that it is today?
I would say with the things that have already been listed, the ratio of applicants to actual housing, the availability of housing, there's a huge lack of availability. And then as one of the Toms, I won't get it wrong if I say it like that. One of the Toms said something along the lines of, if 15 people applied, the homeless person's not going to get it. And that was my struggle. Was I had a checkered background with criminal past history. I had no rental history because I was homeless for 17 years. You don't have stability in homelessness, and they require at least 5 years of rental history, and then 3 times the amount of money. You have to make 3 times the rent. So I have 5 kids. I have custody of all my 5 kids. 3 of them are adults now, so I've just got my 2 youngest. But when I needed a house for all of my children before they started coming into adulthood, I needed a 4-bedroom. I got 3 girls and 2 boys. In order to make that happen, the price of rent is so high, it's almost next to impossible not to actually be able to afford it as a single mom. I personally work 3 jobs to make rent, and I have a roommate. And that's, it's the cost of living here in California and the lack of housing availability. That's what I feel.
So I agree with Chris, and I think for me, it's the stigma. I think that's been a big problem, especially in our society today, the way that there's such diverse opinions, and they're really strong. But the stigma of, it's always been difficult for me that when people see homeless people, they think it's a safety issue. I have dealt with, like I said, with Palco Marsh, the stuff that you're down there. I was back there daily, dealing with cleanups, dealing with other things. People see other people that don't look like them, and they feel that it's not safe. And somebody yelling at themselves on the street, I can understand that fear. Some people treat that as a really big safety issue. And I think that makes that stigmatism that much worse, and makes, that derogatory thing towards those that are unsheltered happen. And I'll say, when we started doing Pathway to Payday, we learned a lot. We couldn't hire anybody. We're a municipal government. We have changed our hiring practices like there's no tomorrow. We wouldn't touch a person with a felony, and we have hired multiple folks, and it's proven to be successful. We've had, our non-successes, but we have a lot of successes, and I think that there's a lot of businesses that come and participate that now, and starting to see that giving people a second chance is worth it, and it's better for our whole community. So I think that stigma is a big problem, and the association with homeless people being threatening or not making you feel safe.
I think to add to that, and again, really, first of all, the housing inventory piece is a huge part. Does anyone here know the number 1 cause of homelessness? Is it mental illness? No, it's losing your house. That's it. And many of the people that I actually, patients that I get to see at the level of working in the community who have been chronically unhoused for a long time. I know them from the old days. They used to have a place. They get a Social Security check. Once upon a time, that check could actually get you a place to live. It can't anymore. Added to that, there's a thing called evidence-based medicine. It's really what we do. Once upon a time, they talked about practicing the art of medicine because we really didn't know very much and we were guessing a lot of the time. That's just honestly how it was. And over time, accumulated data. We work on people, we do things, we check things out, we weigh them, they nationally put the numbers together, and you start seeing a picture. And one of the things in evidence-based medicine that is the truth is that being abused is a form of trauma, and it affects how you react with the rest of your life. Being neglected is a form of trauma. It affects how you react to the rest of your life. And being homeless is a form of trauma. It's an accepted form of trauma. There's a diagnosis code for it that actually shows that it's a bona fide health condition. When you're homeless, it's affecting all of you. It's affecting the way that you relate to the world. It's affecting how it feels to be in the world. And so that, along with that stigma, that constant inflection from people, the constant deprivation, and then the fact that there's really no place for you to go, that all you find is the answer is no, not here, not with us, not today. That makes it really, really challenging. To, even if you get an opportunity, to be able to really return into feeling part of the community. For the homeless in this community, they are community members. They really are. If you don't think about them that way, though I think most everybody here who's here today interested does, but it doesn't feel like it necessarily from their perspective. And they have community amongst themselves, and we see that demonstrated consistently all the time. Bringing them back into the fold of the larger community takes not only removing that stigma, adding housing inventory, but helping them do the work of coming back from the trauma of having been made homeless. If you have never slept outdoors without resource, try it sometime. Give it a try. Do it for a week. See how it feels. I know it from firsthand experience. People up here do. And we see the results of what it happens in people's lives when that happens to them, and that's for a short period of time. Longer periods of time can be really devastating. We see the impact on their physical health, their mental well-being, and their emotional well-being. So I think that that's why it has become the kind of challenge that it is. And honestly, you hear it all the time, but I want to say it out loud. The real measure of a community is how they take care of the poorest, the most vulnerable, the least resourced, the least able. I remember going to Washington, D.C. a number of years ago for a national forum, and I had never been to Washington, D.C. before. So I'm there in the capital of the wealthiest nation the world has ever seen. We make the Romans look like they didn't know what they're doing. And I'm there in the center of money and power and privilege, watching the haves physically stepping over the have-nots. Their downtown looks like our old town. People laying in the street, people camping in tents, people in the challenge. And that's a reflection of how much we care for our poorest, our weakest, our most disadvantaged. Yes, problems come and people act up, but that's only a result of if you're agitated for long enough. I don't know about anybody else. If I don't feel good for long enough, I start being a little less nice to the people around me. Imagine what it's like when it goes on for a really long time.
I think that that's a really excellent conversation. What I would add to that too, with what you're saying, Thomas, is that the health issues and the mental health issues and the substance use that comes out of that then cycles back into continuing homelessness, and it becomes this nasty cycle that never ends. Right? It is both the cause and the effect in this situation. The follow up to that would be, what would an acceptable solution look like to this problem? We're going real broad right out the gate.
I was going to bring this up earlier. For me, doing this for so many years, I don't know if there is a solution. I don't think we need to look for we have to do better. That's for darn sure. But to think that there's just not going to be homelessness ever, and there's a magic pill that's going to get you there, I don't see it. People go through a lot of traumatic things in their lives. They lose money very quickly, and then it just happens. So there's going to be things that fall through the crack, but I think we continue to do more innovative things and think outside the box. I think that our elected officials have been extremely supportive of things that a lot of other governing bodies would never touch it with a 10-foot pole. And I understand the concerns that DHHS had when we first started our program because of their concerns and the guidelines that they have to follow and where their funding comes from. But the more that we have different ways of thinking of about housing people and how that's done and putting the resources in to do that, I think that it'll definitely help. But I have a hard time believing that there's a solution to homelessness.
Yeah, there's no one solution. So it's everyone's an individual. You could say, hey, 30% of these folks, for sure, Housing First is going to work with 30%, whatever the number could be. But there's no one solution, no magic pill to this. I think as a nation, let's start with the state of California. We have to look at things, how things are done. But again, look at our homeless in LA, San Francisco. It's different than our homeless here in Eureka. And so what we need is buy-in, in my opinion, from our political officials, our elected officials, to actually listen to folks that are actually working the ground levels. We have a lot of great ideas in California, but then the follow through is usually pretty limited, or it's a mandate without any funding. I think nationally, we spent $25 billion on homelessness last year, I think, alone, or last year, the year before, which seems like a lot of money, but look at the outcomes we still have. And so at some point, we have to have a real talk with people that have influence. They have to be willing to listen to the folks that are actually doing the job, and then actually put in programs that are going to work. But I think a lot of it comes down to personal connections and relationships. You need those programs. You need housing. You need SUD treatment facilities. You need medical facilities. You need mental health support. But if you don't know people by name and are out there with them, that they know who to go to when they are ready, that's probably one of the biggest pieces of that personal connection.
Just to add to what Lenny was saying there, it's been really frustrating for me, like when they did No Place Like Home, I think it was, and we went down to Ukiah and spoke to McGuire about that. We went through a lot of legal battles because we weren't doing things the right way. But we didn't have access to any of that funding. We don't have any access to state or federal funding. And at the municipal level, at the city government level, where a lot of these issues are happening, there's no access to that funding at the state and federal level. And so we tried to argue as hard as possible to make that available for municipalities. Same thing with, and they're starting to come around, but I think it needs to be made accessible to all government agencies, nonprofits, those people that have different ways of looking at things to get them done. We're a smaller entity. Like Lenny says, if we have a problem, we can go and use our credit card and buy a personal hotel room. I don't think that can be said at other bigger agencies. And so I think that funding needs to filter down to other agencies.
I think too, the move towards a solution, and yes, I think it's complex. I don't think that there's any one solution that takes care of the whole problem. What it is that we move towards where we are doing better, and actually a good bit of it started here already, and like everyone at this table has been partners with Open Door in creating better relationships between entities, so that it's not just any one of us that's hitting away at this work, it's all of us together. It's us helping people, lowering the barriers so that people can move more smoothly from point A to point B, and the agencies can work together to try to cooperatively do that. We do need more housing inventory in the background as a way to move those forward who can be moved there, right now. But along with that is the city has worked with us tirelessly to make it possible for mobile medical services to go be places, who then works with AHA and Arcata House and DHHS and the police and the rescue mission to move people to where it's a good fit for them, to move them towards the resource that they as an individual need at that time, to be more able to answer to needs in the moment and with less delay, with less barriers to our communication as agencies. That's the kind of future that could really make a huge difference, is if we can keep moving towards that. I do agree that having funding coming down from the state and federal level that actually reaches municipalities, because it's the municipalities that do actually carry the ultimate responsibility. These things happen in towns, they happen in cities. And while there is some stuff that happens outside of incorporated areas, it's largely there. And those are the folks that are largely carrying the responsibility. And it's not that the county's not working and the other agencies aren't working to try to work with those municipalities, but sometimes it coming directly can make a huge difference. But in the end, a big piece of it is to have enough housing, at least for those who are willing and who are able right now. Again and again, we find folks that keep falling back into that cycle of challenge because we can't get them sheltered long enough to get through their current health crisis. Even if that's only temporary, during that time, everything improves not only for them, but for everyone around them. It's the same concept of harm reduction that we see in substance abuse services applied at a community level. Whenever someone is in a better place, everyone's in a better place.
And I would just add that creating off-ramps out of homelessness, it's really important because it's just, homelessness is a trap. And when it gets its grips into you, nowadays it's practically impossible to free yourself from it. It's terrible, and the damage that is happening while you're from being homeless keeps like magnifying, and it's just a terrible situation. And to create off-ramps out of homelessness, it generally happens through government agencies or nonprofit agencies nowadays. And it used to be that it was easy. It's just easier to when there was more inventory and more. When it was easy, when there was more work available, and when then it was easier for people to get out of homelessness. Nowadays, we need to provide those off ramps, or people are just going to remain homeless, even if they're ready to make changes in their life. They need supports. Thank you.
I think one other thing I want to add really briefly to dovetail off of something Miles said earlier is about the stigma. Honestly, I think about Kristen's story about not being able to get a place, not because she didn't have money, not because she hadn't done all the right things, but because stigma, her past was held against her, her situation was held against her. If we create, and it takes every one of us as community members to create this, a kinder, more compassionate society that sees people who are experiencing homelessness as victims too, not some sort of problem. And if we change that attitude, little things will loosen up. Little moments of opportunity will open. Landlords will think, maybe I can take the chance on this, and find out it was a good chance to take, and that kind of thing. So if we can encourage each other, a real solution to this probably starts more in hearts and minds than it does even with money, funding, housing, or anything else.
And I'll add to that too. It's very similar to when we do the Pathway to Payday. There were businesses that wouldn't touch us with a 10-foot pole. And we've been doing this. We did it once a year for the first couple of years, and we're doing it every quarter right now. And we have up to 15 to 17 different businesses that are coming and participating in this and hiring folks from our program. It's very similar working with landlords. Thanks to the county, we have housing assistance funds. There are landlords now that realize that, this is a good thing for me. I have the support. I have the guarantee of the money for that time frame. And so I think keeping and doing that and getting people to understand that this is, your fears will not be necessarily come to fruition. I mean, it's been successful for a lot of not only the housing projects, but definitely for employing folks.
Thank you, panel.
I was just going to say, I kind of feel like if there was more income-based housing, and if there was, with addiction comes criminal activity most of the time. With addiction comes evictions most of the time. Those two things right there will hold you back from getting a place. If there was something set in place where, people could, I know that when I was house hunting, I was bringing character reference letters with me. And I didn't know if that was in my benefit or going against me, because it was putting me on blast to any and everybody that I was putting in an application for. But if people would have just a little bit more compassion to the evictions and, with the housing that the city of Eureka guarantees payment of, if there was more landlords that would come forward and take a chance, if more people would take a chance on the homeless community, I think that there would be good stuff coming out of that.
Thank you. So that was our first kind of write-in and a half. If folks want to come up to line up on this side of the room to ask questions, then we can start taking some questions from the audience. You want to go first? Yeah.
Hello. Thank you all for being here. I appreciate it. My name is Roy Gomez. I'm a local business owner. I've been a business owner in the city of Eureka, resident, father in Eureka, Arcata, all Humboldt County for the past 20 years. I've been here almost my whole life, and I do appreciate your guys' experience, and I do sympathize with what you've gone through. And like I said, I'm a father myself, and I certainly do try to make sure that my kids understand that their choices are very important in life. And, I do feel that homelessness at a certain point is a choice. Some people become addicts. They burn every bridge that they have being an addict, steal from their parents, steal from everybody, and it becomes a choice in a sense. And I think some of my question for you three is, do you feel also that consequences of those choices have to do with homelessness and the choice to do the things that you've done that led up to that? Another question for you, Miles, on the Home Key grant. I'm curious, and I asked this question before but didn't get an answer when we had this Chamber of Commerce meeting. I'm curious if the city plans to use eminent domain. There are some city council members have made it public that was in the arsenal of the city and would take property from commercial property owners, eminent domain, if the homeless population increases. I'm curious if the city is still considering doing that. And Sir LaFrance, you mentioned a quote that stood out was, "Without accountability, there is chaos." And I agree with that 100%. And I'm just curious, on a foundational level, if holding members of the city council accountable for being anarchists, as well as wanting to decommission or dismantle capitalism, there's been 4 different annual symposiums, 2-day symposiums held and organized by the Ink people and Synapsis. And I'm curious if holding them accountable for those views and what a 2-day symposium, can we get like a town hall meeting? There's a lot of business owners who may not want to dismantle capitalism. David Cobb, Leslie Castellano, all of these people who have held these symposiums never held a town hall meeting with business owners to see if they want to dismantle capitalism. And these are foundational issues that I feel need to be brought out and discussed before moving forward, and they should be recusing themselves from anything budgetary if they want to dismantle capitalism, which I realize the conflicts of interest are not held because there is no actual code of ethics being followed. So with that, thank you all for being here.
You guys want to start?
I think so just correct me if I'm wrong. The first question is this a choice, right? And what are the consequences of that choice? Does that sound right?
Homelessness can lead up to that as a consequence, and whether that could be taken in as a personal responsibility as opposed to putting it on people.
Okay. I think that for the interest of time and everyone else, I want to do the first 2 questions because those directly relate to I think the topic today. I want to step away from the city commerce component. Is that okay? Okay, I appreciate that. Thank you. So let's kick the first one to the panel, and then Miles, if you want to take the second question.
So on the topic of choices, like, did my choices lead me someplace? And yes. And did I fully understand the consequences of the choices I was making when I made them when I was a teenager? Absolutely not. That doesn't make me not responsible for that part of my life. But I want to point out 73% of the people that we see on the mobile van who are experiencing chronic homelessness actually have a diagnosis of mental illness. And the overwhelming majority of them were diagnosed with that before they were homeless. They actually were many cases where people who depended on a certain other one, usually a family member who helped keep their life stable, helped them remember to take their medications, helped them navigate life. And then very often that person passed away or disappeared from their life. And then they slowly, gradually fell into homelessness. They began to lose their ability to navigate. They began to lose their ability to respond to things. Is that their fault? And I don't think so. I don't think that's a choice. I don't think people are born choosing to be mentally ill or having some of those challenges. So it's not a simple answer. There is a responsibility component. Absolutely. Do we make choices in life that have consequences? We sure do. And there are forces in our lives that are larger than we are, or that, some of us are able to overcome because we're better resourced, better situated, have better help, and others do not. It's not equal in what people have access to. And I think that that's where it plays out kind of both, yes and no, that it's like that.
And I would have to say, me personally, I take responsibility for my past choices, and I understand consequences. Ever since I was a little girl, I knew the difference between right and wrong. Did I understand what addiction was doing to my future in the midst of it? No, I didn't. I did not realize that I was possibly destroying any future that I may have, because in the moment I was partying. That's all I cared about. To have consequences is one thing. To not have the ability to get a fresh start when you change your life it's really difficult. It was a really, and like I said, it was denial after denial after denial because of my past. But I was living in the present. I wasn't the past anymore. I was the present, and I was doing the right things in life. I was taking the right steps. I was building the right networks. I was, taking care of my mental health first. I was doing everything that I was supposed to be doing, but I was still being told no. Landlords have an advantage here. Homeowners have an advantage here. And it's once you fall into the grips of homelessness, it's really, really hard to pull yourself out of. With mental health illnesses and issues, it's even harder to pull yourself out of. Running the shelter, I see people that, they try to do the right thing, but they just don't fit into structure. And what do we do with those? The ones that aren't safe to be around the children, so they can't stay at the shelter because it's not okay for somebody to be screaming at the top of their lungs at 10 o'clock at night. What do we do with, where do we house those people? Everybody deserves shelter and food. That's a given right. That should be a given right. Shelter and food. Nobody should have to fight for that. Nobody should have to struggle for that, but it happens every day.
Well, I've met a lot of homeless people in my career, and I don't think I've met one yet that said that they prefer to be homeless to having a house that they could go home to and be safe and dry and warm. I think that a tremendous amount of the people who are unable to pull themselves out of homelessness experienced a lot of childhood trauma, childhood poverty, didn't have the same opportunities or they weren't, many of us had a lot of advantages growing up that probably are not real common amongst the homeless population. Is it a choice? I suppose, on some level you could make that argument. But I know with the addiction component, it starts off really fun. It was a lot of fun drinking and doing drugs, and it was all great for a long time, and then it became not so fun, and then and by the time it was a real problem, and I couldn't remove myself from it. It had been many years and a lot of water under the bridge, and it's difficult, and so was that did I make that choice to be a drug addict? And I suppose, but it didn't at the time. It didn't seem like that was what I was doing. It just seemed like I was just embarking on an adventure that seemed like a lot of fun, And then by the time the trap was sprung, it was too late. So.
And then as far as eminent domain, I don't know, the home key grant doesn't require that at all. The home key grant is, we've applied for multiple of them. Each time we reach out to the property owner, see if they're willing to sell. One of them was the Pine Motel prior to it being sold. We were about to get that. We weren't successful in getting that grant. Currently, we're working on a willing private property owner to purchase their property and build on that. But for home key, A, the timing of it wouldn't work out very well, and B, I could tell you from a staff level, we don't see any interest or need to do eminent domain. We have actually bought a lot of property recently. We're actually going to be purchasing more property coming up, but we just purchased a residential property on Sunny Avenue. We purchased another kind of wetland property on Sunny Avenue. For the housing projects themselves, we've offered up city-owned parking lots and traded city-owned parking lots for with willing private property owners. But in my discussions, there's never been any discussion about eminent domain. I know that the public has talked about certain properties that they want to have eminent domain, but we have not had that discussion.
Thank you, panel. You want to come up next? Oh, and just a reminder, if you could give your first name when you're at the podium, just so that we can address you if we...
Okay.
Yeah. Thank
My
you.
name's Harry. Thank you, Kim, the mayor, for holding this get-together. Thank you to the panel for being here. I've been making notes and thinking about things. I'm originally from New York City, Queens. I lived in the street for 19 months. If you've ever been in New York, winter is really nasty. I was homeless due to a divorce. She took the house, I got the street. But at that time, I'm a returning Vietnam veteran, and I had PTSD, didn't even know it, but I started self-medicating. Being on the street, I needed to self-medicate to survive because I was in survival mode. Nobody came to me and offered me anything because the systems were not set up. Yes, Eureka is great for all the systems that are there and available. But I have one very serious question. What do you do with people who absolutely are so mentally impaired that they cannot make good judgments, that they cannot help themselves, who become violent to people who do try? I've had my nose broken twice in Cooper's Gulch trying to help people. I know at least 51 people down there by name because they trust me. I know I look a little scruffy, but that's why. I believe that the problem started when we closed the mental institutions, where we could take these people, bring them back to some semblance of normalcy, a routine, food, clean clothes. I know at age 13, I was in Hudson River State Hospital for a period of time with childhood disorder, and I was having seizures. And I saw what they did. There were people that were there 30 years who couldn't have made it on the street. But when they closed these places, they just turned them out. They did not keep the promise of outpatient clinics and follow-ups. I want to know where that money went. I want to know where that commitment to the mentally ill went. As he very well put it, all of the other problems come second once you're addicted. Nobody wants to rent to someone who's violent, talking to themselves, destroying their property. I know when my kids grew up and moved out, I had 3 bedrooms, and I took in people from HRC, the male version side, which is right next door to me. And yeah, there were a lot of good people, and we worked hard, and we got them out of it. But then there were the people who destroyed my walls, threw my microwave, fought with their parents. It was horrible. The police could not do anything. And that's something I wanted to ask Officer LaFrance. What is the situation where mandatorily you can do something for these people who are in the street, hurting people, hurting themselves? You know, I thought there was a system for that, but there doesn't seem to be. And we also have people dying out here. No kidding. We just had someone die in a bus stop and nobody knew he was dead. That's terrible. We've had people die in Cooper's Gulch, and all you've found is a femur or finger or something. This should not happen in a society as rich as ours. This should not happen in a community that claims to have compassion. There's a difference between compassion and enabling. When you hand people needles, shooting up kits, and you dismiss their behaviors, that's not helping, that's enabling. That's allowing them to continue. In New York, and one of the reasons I quit, is they had a thing called the Rockefeller drug laws. If you were caught with one syringe, you got automatically a year. 1 year for every syringe you had on you. Prison? Yes, prison. You didn't go to a mental institution, you went to prison. And the judges had no discretion. Yeah. None whatsoever. Same thing happened with an ounce of weed, whatever. But as I said, the problem is we have no place to put these people. John Shelter came up with a great idea, I'll say 6-7 years ago, a triage center, a place where all services are. And we were talking the last time about a mobile van or vans to pick these people up and bring them to the services. The ones that are really bad, I guess you have to take the sempervirens. But what can the police do about these people who are laying all over? Is it part of the law that they're allowed to sleep on my driveway? These are the questions I have. And what can we as citizens do to help you to get these people into services or get these people? Because I don't like the idea of people coming to my driveway, setting up a tent and pooping all over my driveway. And I'm sure the business owners don't like it. And Kim, it's not going to help tourism. I know I've been rough on you, but I'm only trying to wake people up. I'm only trying to make people see that we are all in this together. I am proud of the people behind me for coming here today. You don't usually see a crowd like this. And I'm very proud of these people. And every one of them deserve a thank you. But we've got to start doing more of this. We've got to start talking with you all and working with you all and finding out. One last question I have is for the police officer up there. I wish you would answer this. What can we do when we have a violent, drug-addicted, crazy person on our property?
Thank you, Harry. I want to break your question into two questions. One, I want to talk about, and Commander LaFrance, maybe you can answer this one. What can law enforcement do in these situations? But then I also want to broaden it out. What goes into involuntary detainment, and how does that, like involuntary outpatient and all that? And maybe we can have a little bit of a discussion around that after.
Sure. So the answer is what are we legally allowed to do? So if you have someone on your property that's causing an issue, being violent, if they're physically committing a crime, then you have to be a willing victim for them to go to jail, unless it's a felony. So if it's a misdemeanor, which most of these are, basic assault and battery, criminal threats is a felony, but that's to get to that realm is pretty hard to get. It's called a 422 case. But you have to be a willing victim for that person to be taken into custody. That's the first thing. Two, when they do go to jail, then at that point it's off Eureka Police Department's hands. We don't run the jail. It's up to the county how they run the jail. Then of course will the courts prosecute them. So when we write the case, send it over, are the courts going to prosecute that case? And in many, since they're overwhelmed right now still with cases, sometimes they don't, sometimes they do. It seems like often more times, sometimes they don't. If you're having a repeated issue with an individual coming onto your property, of course, you can file a restraining order, and we also have an EMC code that allows us to do a individual trespass letter for the individual. So if Ben Smith keeps coming to your property, we can get a form. You can literally fill out a form for Ben Smith not to be in your property. If you commit the violations of misdemeanor, they can go to jail on that as well. The issue is, of course, on the back end, we're literally putting Band-Aids on the bigger problem. And until there's more things in the system in place to actually hold people accountable long term, that's what we definitely need for those cases that they are unwilling to comply with society, unwilling to accept the help that we continually offer people. There has to be a backside of that with accountability, saying, hey, your behavior is unacceptable, enough's enough, this is the next step for you with accountability. And I think we look at a lot of the, even like you look at Prop 47, decriminalization of drugs, was that good and bad? Both sides, yeah. But where's California today right now? and I think we're probably in a worse spot. Because years ago we had BP 4140, which you had a syringe. It was a misdemeanor. That, of course, that went away. And I'm not saying I favor that or didn't favor that. But again, the laws changed. And I don't know if we're in a better spot now than we were then. But it's there has to be things coming out of the state for accountability measures, because in many regards, from a law enforcement standpoint, it feels like we're going more towards the chaos than towards a balance of accountability and compassion. And you have to have both.
And I think, as far as the involuntary treatment for mental health, I mean, obviously we have the 5150 laws, right? We can handle crises. What I'm hearing you talk about those more chronic situations, where how do we get folks into more longer term care? And, and Tom, maybe if you want to jump in on this at some point, let me know. But, when psychiatry and psychology really started out, the pendulum swung way over to taking away people's rights. Right. I mean, to the point where 30, 40 years ago, a husband could drop off their wife at an institution and commit them, and that would be it. There wouldn't be a lot of investigation that went into that. Right. And so we're very fortunate that the pendulum has swung the other way, because that wasn't right to start off. But it's now swung over to the point where you're right. We don't have some of the care that people need, and people don't have those supports. And so I think the real challenge is, like, how do we swing back to the middle where we have, the accountability of making sure that people's rights aren't being taken away unnecessarily, but we also are getting people the treatment that they need, and if they don't have the insight to needing it, that we have the mechanisms in place to help them get it regardless. The state of California is taking some steps towards that. Humboldt County Behavioral Health in the last year kicked off their assisted outpatient treatment program, which is involuntary outpatient. It's court-ordered treatment. And then California, on a larger scale, is in the next year implementing Care Court, which I think for 7 counties is implementing end of this year. For the rest of the counties in California, will be next year. But Care Court is going to be a statewide version of AOT, where there's court-ordered outpatient. And that can mean court-ordered medications, that can mean court-ordered therapy, that can mean court-ordered dual diagnosis treatment. And hopefully that kind of brings us back down to a space where we can help some of those folks, and we have that missing tool. For folks who have anosognosia, the symptomatic lack of insight, their disorder causes them to not recognize they're sick. And hopefully we get a new tool in the toolbox for that. The concerning piece, I think, for a lot of folks is that those mandates don't have funding.
I don't want to take up a lot of time. One more thing reason I bring this up. There's a young lady who was slaughtered here, just absolutely slaughtered and tortured by a patient who'd been seen at least once a week at Semper Virens, and the police department had almost daily contact with her. She killed Hannah, went down the street, stabbed somebody else, and she was out in 24 hours. Literally, she was out in 24 hours. She was taken to Semper Virens, they gave her meds, and then put her in the streets. She was not sane. I do not blame her. Her mental illness made her do this stuff. But why couldn't that have been held? Why couldn't she have been held longer? Do we need more Hannahs to get this system squared away?
I certainly hope not. And I don't know that situation in particular, but it doesn't sound like the system functioned as it should have. At the same time, it's also impossible to predict behavior, right? I mean, the only predictor of aggression is past aggression, and much beyond that, it's kind of a crapshoot in prediction.
Well, there'd been mandatory treatment.
Yeah, and hopefully that would help prevent future situations like that. Tom, do you want to add?
I just want to add a couple of, there are things coming up that the county is working on currently. I mean, we have a residential adult outpatient treatment facility that's got a building plan in, that's right here in Eureka. And then we have Sorrel Leaf that'll be for kids as well. So I think that's been a problem as well, is that once they get out there, they just go straight out onto the street, and there's not another facility for them to go to. But those are coming.
Yeah, the laws are changing, hopefully, eventually in California. So right now you can go on a 5150 hold for being gravely disabled, danger, self-danger to others. And that has to be quantified when we have the ability as police officers to write those. And we, CSET, they respond about 40% of all mental health calls for the city of Eureka. They are our mental health experts in the field, by far, the officers on that team. They write a lot of holds, or they have in the past. But again, the criteria is gravely disabled because of a mental illness, danger to others because of mental illness. danger itself because of mental illness. And so not because they're addicted, because it has to be based on a mental illness. And so the state is I think, moving towards also substance use as well on top of that. But it's very challenging. And if we do want to take people on holds, we have 26 beds in the ER. There's actually 20 beds. They create 6 beds in the hallways, and then there's no room. So obviously, we've made great efforts with EPD and with CARE to divert people away from the ER when appropriate, to make sure we can get them stabilized, but not taking up a bed in the ER. Because when you get placed on a hold, you go to St. Joseph's Hospital in Eureka. You don't go to Semper Virens. You go to St. Joe's. That's the intake place, and then eventually they have a team from the county comes in. They do a evaluation to see if they're going to uphold the hold or they're going to rescind the hold. And at that point, the person stays. If they're held, they'll stay there until they get placement. If they're rescinded, they're sent out the door. And so, it's not a perfect system, but we've definitely made since 2020 made some major progression forward with that. But it's very, very challenging, especially on our end because we write a lot of holds.
And I just add that mental health services, by and large, are voluntary, and it requires buy-in from the person who is participating in order for it to work anyway. So we can mandate people into treatment, but what does that ultimately mean? Does it mean that we're going to have somebody shoving their psych meds down their throat every morning if they don't want to? No, it's not going to. We could say you're required, court ordered to take your medications, but ultimately that if it doesn't go into the person's mouth, it doesn't really matter that. And so personally, what I think is that we, as a society and as our local systems, providing more housing for mentally ill people. They become more mentally ill people that experience homelessness become more mentally ill. People that aren't mentally ill that are experiencing homelessness often become mentally ill. And it's just a terrible, and the only real solution to it is providing the resources to house people who are suffering homelessness and mental illness, in my opinion.
I think just to add to that, the other thing that we can do, and the challenges of working with folks and, having somebody laying in your driveway regularly and all of that, I'm incredibly sympathetic to what it's like to have people invading part of your life. And it's not okay. Being mentally ill or being homeless is not an excuse to treat other people poorly. That doesn't justify any of that. But for many of these folks, they're not in control of their behavior. If you're mentally ill, unaware that you're mentally ill, you're responding to the world as you perceive it, you don't understand the consequences of what you're doing. And the fact that our system isn't still well set up to accommodate that, as has been spoken to, is a really big thing. But one of the things that we've noticed does help and make a difference is the more people that regularly engage with those individuals, particularly at moments when they are a little bit more open, willing, in need of something, and that we can begin to engage them into care and conversation, a lot of those behaviors tend to decline. It's not for everybody and not for those who are in the most severe situations, but for many of them, it gets better. They begin to come and engage with us first. When they start to feel frustrated, they will come and engage with any one of the groups that are being mentioned here today and the community partners. And that engagement is often, they find a solution for their thing of the moment. They find a way forward through today in which they don't actually have to go and maybe commit something that turns out to be harmful. They feel for one moment heard, they feel for one moment cared for, and that makes a difference, and it gets them through one more day. And getting through one day at a time, I can tell you from personal experience, is about the only way to do the deal. Honestly, tomorrow is not ever here, it's always today. And so helping people today can often work through those things in regular conversation. Hearing that people get hurt when they're attempting to help, is alarming to me, and it's also the reality. Being wise, being safe, I think, is a really important thing. Engaging with us and with law enforcement and with others as much as you can to try to keep the engagement with that individual. I do think that better things are coming. The society is becoming more aware of these challenges, but it is federal and state law more than anything else that has to change around this, because it is about the rights of individual human beings. Every single one of us, when someone tells us what to do, who here likes being told what to do? Please raise your hand. Right. And everybody else feels exactly as you do. And that's what we're talking about here. And so who draws that line? You know, as was mentioned, once upon a time, people could just drop you off and say, oh, yep, they're crazy. Oh, great. Let's put a bunch of stuff in them and we'll just keep them drugged up for the rest of their life. We're trying to find that balancing point of human dignity. Even for those who are mentally ill and don't realize they are, they're still people. And so how do we find the way forward to help them and keep them safe? The medical conservancy, where you can have somebody conserved against their will. One of the things about that, just so you know, it's set up so it's not forever. It's constantly reviewed. Providers have to constantly check them out, come forward, testify in court that, yep, they still need to be here or they don't. And when they get to a point of stability, it's considered inhumane to keep them captured anymore. They're not criminals. They're people with a mental illness. And so then they will be released back, and maybe they'll be able to maintain it if they have housing and enough support. And if they don't, they're likely to slide back to where they were before, and we will start the process again. And so how to address that really serious problem is complicated. I wish I had a really cool answer to it, but I do think all of us working together in partnership, and particularly, you know, when you see my team, you have somebody in your neighborhood that you're seeing regularly there that needs engagement. We have people we send out beyond our van who go around and engage with folks and try to bring them into care and try to hook them up with the other services and try to, you know, encourage them to come be where they can be reached. And so that can be one of the ways forward.
I just add one other little thing, that state mental hospitals are insanely expensive. And we could pay for a lot of community housing for people with mental health difficulties by avoiding state mental hospital hospitalizations.
Thank you, panel.
Hi, my name's Bill Taylor. I would guess about 10% of the homeless people that get housed every year. And the other 90% are the ones I'm concerned about, that are living rough, as you said, one of the Toms said, miserably, I think, is living rough. And Kim experienced it a couple years ago trying to spend a night out. And I admire you for that, because I'd never try it myself. But I'd like to some way to help these 90% reduce the misery of living outside. One of the things the city does, and has been doing for years, is they just keep moving people around. They move them from the marsh to Cooper's Gulch to, you know, wherever. And it seems, I don't know what the thinking is, but they just move them. You know, they don't reduce them. You know, these people aren't going to evaporate if you move them. You know, and that makes life miserable for them. I mean, if you guys had 10 days or 15 days or 30 days notice you had to leave your house, you'd be freaked out. You know, and they are too, you know, and they're figuring, well, you know, what can I put in a shopping cart? Because, you know, I got to leave some of my belongings behind. Where am I going to go? So getting a stable place would reduce a lot of misery there. The other thing is putting out dumpsters so they can take out their trash. You know, we complain about, you got this trash all over. Why don't we put some dumpsters out and they can put out some trash? Why don't we put out a couple, and also not just put out the dumpster, but service it every week or every month. Also put out some porta potties, you know, but service those, not like we did in the marsh where we didn't service them. They overflew, they overfilled, and the people pushed them over because nobody come out and service them. So there are things like that and maybe, you know, hire a couple, you know, pay a couple of people in the camp or something to kind of go around and you know, take trash cans to the people and try to encourage them to clean it up. So that's my ideas. Thank you.
Thank you.
I don't know if there's a question in there, but I can respond to that. So we have a lot of experience from dealing with the different locations that we have. Some of the locations that you're talking about are definitely private property, and it's up to the private property, and they are relocating people. When we talk about dumpsters, so when we had the Falcon Marsh issues, we did put out dumpsters, and what was happening is that we had housed folks coming and dumping all of their material there, and we were having to routinely on a daily basis take out multiple 40-yard dumpsters at that location. The issue that you spoke of about the porta potties were I think 2 or 3 times, and I have the receipts, 2 or 3 times a week were pumped, and there was the issue, and that company chose no longer to service it because it became an issue and people were dumping them over. I forget what else was there.
I think
No, so what we've done, so the solution that we've done, no, I'm not saying that at all. So when we go out and we have our outreach workers and we go out and we have interactions with folks, we meet them where they're at, we provide them trash bags and say, here, put these in the trash bags, we'll come and pick them up from you. We do that on a routine basis with CSET, with our harbor staff, with our park staff, with our uplift staff. We continue to do that. As a matter of fact, we did it this week at along the Hickshari Trail. And so we will continue to do that in order to help alleviate some of the environmental issues that come from this. But we have had experience in dealing with the dumpsters, and that was a huge problem and a huge burden for us financially. I can tell you that we had, I think it was 145 40-yard dumpsters in the 3-month period that we were dealing with that area back there. And it wasn't from those folks that were back there. It was people coming in illegally dumping back there. We had huge issues with that, what we call the pole shed property, which is just to the north of the Bayshore Mall. People were coming and just dumping material there. So it was an issue, and that's definitely something that we need to work on. Like I said, we want to make sure that we have enough shelter spaces without any barriers for people to go to. I think that's what we need to do, because putting them in a tent on an area that's going to have the same type of problems that we're talking about here is not adequate. I think that we need to go out to Home Key, and we need to find this grant funding, and we need to build shelter space. And we need to build shelter space that doesn't have barriers. And so I think that is a more humane solution than saying, hey, you can stay here and still have the problems that you're already dealing with now.
But it's a 5-year thing until you get.
It's not a 5-year thing. Home Key gets funded within, I think, August. Help me, Darlene. And then we have a year to put it up. So it's not a 5-year thing. It's very quick. 60 beds. I don't know about all of them, but I can tell you that it's going to get there, and we need to continue to do that.
Yeah, and it gives some data points on after Palco Marsh. We saw the rotating encampments, which were a disaster. We had crime increase by 20% in each property crime, 20% at each location. So right now,
and that property crime was based on those individuals staying there. Yeah. So it was bad for them, not the adjacent neighbors.
Yeah, and then same right now with behind the Bayshore Mall, we're having some difficulties just from a staffing side, addressing all the issues. But our CSET team, they walked into an encampment with a tent just full of brand new property that was stolen from Walmart. So we're seeing a lot of crime issues, property crime issues. Not saying that's a majority; it's probably a very small minority of our homeless population that are engaged in that behavior. It's still unacceptable. It's not an overall strategy to move people back and forth, but if we have an issue with an encampment, we address it. We have a lot of folks that we know where they're at. Their encampments are not a mess. You have no idea they're there. Guess what? Very low priority for us. But when they are causing an issue, either violence, which happens if they're dealing drugs, if they're stealing, if they're creating significant environmental impacts, which I probably should have built a PowerPoint for this one. But we can show you the impact, and those ones are obviously the ones that prioritize to address. And it's not like we go in there, hey guys, here's your notice to vacate, have a good day. It's, hey, Robert and Larry from Uplift, come in with us. Hey, Jacob, bring your team with us. CSET's there, we're offering services, and a lot of those folks involved in that kind of behavior, that is a choice for them.
And I can speak on that because whenever they go in and clear out the encampments, they usually get in touch with me over at the women's shelter and say, hey, this is where we're going. You might have some people coming your way. The people never show up from the encampments. They choose to stay out there. How do we get them in? How do we get them? By building the relationships and rapports.
Yeah, and I'm not against if we wanted to. We had the special meeting a while back about sanctioned encampment. I wouldn't be opposed to having a managed encampment. We've done research upon it. There's a couple different documents I've seen and looked at. As long as it's done properly, we can have that set up, but it has to be a managed perspective. It can't just be chaos.
Yeah, and we fully support those things. And so if there are interested party, I'll say it again, just like I did the other time, please give me a call. We will work on that, and we'll find a program that will work and be in compliance with our zoning and be in compliance with the emergency shelter cabin building code. We went through all of that and discussed exactly what that requires, and it's not that big of a hurdle. And so if there's interest out there, we'd be more than interested in hearing from you.
And on that note, if I remember correctly, it's a lot easier to do that on private property than it is on public property. Is that correct?
It's more zoning. It's much easier to do it in the inland zoning code than it is in the coastal zoning code. I can assure you that.
And while I hear the desire for people to not get moved around and to have a place to be, and I want to see that. I think the thing that speaks towards managed encampment versus uncontrolled encampments is, from a health perspective, is honestly particularly the sanitation issues. We have seen, and COVID was actually a really good chance for us to see it firsthand, to watch the spread of disease through groups of people living collectively in places that aren't meant for human habitation and where there isn't adequate sanitation and access to clean water and those things. And we've seen the impact of people getting potentially deadly diseases, not just COVID, but others that spread, particularly illnesses that are intestinal can be spread that way. Exposure to fecal matter into urine can be dangerous over periods of time. And the other thing is that when folks, if they place themselves in encampments, particularly when they're farther out of reach, a lot of our services, like we can only get so far afield, and then when they begin to not come and engage at places that we can get to them, then they begin to lose out on the other things that we have to offer, whether it's connection to social services, connection to food, or other support, as well as the medical services and the behavioral health services that we offer. And so the thing about managed encampment, if we can move in that direction, does add a place to be, a place that we can engage, safety when it comes to sanitation, particularly treatment for other forms of transmissible disease, whether it's sexually transmitted diseases, things that are passed by coughing and sneezing and so on. Influenza is a deadly disease. We have so many people vaccinated for the flu, we forget about it, but once upon a time it was one of the major causes of death in the United States in the 20th century, up until we began to be good at vaccination. And so we want to be able to stop folks being in places where disease can spread uncontrolled.
And Tom, I think you had a comment as well.
Well, I share your concern about the sizable population of people who are going to continue to experience homelessness on the streets of Humboldt County. And the managed camp is I think a really important thing in order to reduce the amount of trauma that homeless people experience. It gives the opportunity to provide some degree of supervision and to minimize some of that the preying on the homeless population that happens. And in a managed camp, it brings all the population into a more tighter geographic area, which allows more efficiency when it comes to providing services and doing engagement and outreach and all that kind of stuff, and working people towards exiting, providing those off ramps to homelessness. And if you think about it, what the rescue mission has done an amazing job for decades and decades with, I don't think, any government support or very little, and they're a fabulous organization. And what they do is they manage people that are homeless. They don't people that are in the rescue mission are not they have a roof over their head, but they're still homeless. And that would be the same thing with a managed camp. It doesn't solve the homelessness problem, but it helps us manage it, and it gives us opportunities to intervene and do a better job of helping to help people exit homelessness.
Thank you, panel. Kim, did you want to do a...
So we'll do one from the cards. let's see. What services or programs are planning on providing in the near future? Does that make sense?
Yeah, I guess it does.
Can you make it make sense?
I can make it make sense.
I'm just reading what's here.
So, we've discussed a lot of this already. Obviously, we have every intention of expanding our alternative response for mental health. We have every intention on doing it as a 24-hour program and are looking at funding sources in order to do so. Right now, we have the managing mental health clinician, a couple other clinicians. We'd like to get up to, I think, 6 clinicians and 2 managing. 4
clinicians, 6 case managers.
Okay, sorry. So anyway, that would give us the ability to go 24/7, and that's a program that we plan on expanding. We're always expanding. We had to stop some of the programming for the Uplift program, our co-pilot program, which is basically the volunteer program that gave one-on-one opportunities for volunteers and a community member experiencing homelessness to help them get through whatever barriers that they have. That's coming up again. We just started the job skills training program back as well. As far as facilities are concerned, we are going to have 33 new transitional / permanent supportive housing at the Crowley property that went through a very long zoning process in order to get there. But the prefabbed units are being delivered and should be in here in July. And we're going to have a big build day with the community sometime in September, late August, early September, to put those together. And that will have a shower facility, a dining facility, and 33 units there. Thanks to the county, we recently received $115,000 from the HAP money, or HIP, one of the two, HAP. That is going to go to hopefully alleviate some of the loss when AHA stopped running their showers. That'll be showers for all community members, just not those community members at the Blue Angel Village. That'll be available to folks. The county is working on the navigation center, which was a huge project that's been talked about for at least the 17 years that I've been here. That will provide more housing, especially I believe they're going to be concentrating more on those with mental health issues. I think there's 11 or 12 units there. And we'll also have a day center for people to hang out with kennels, places for storage for their belongings. And we're hoping that will happen by next year. I don't know, as long as we get that contract in, I'm hoping by next year. What other projects? We have all of our affordable housing projects. Danco's almost done with their 36 units of senior living at 6th and Myrtle. The Link project just made it past the first round of the $50 million grant that we were going for the funding gap for that. We'll find out about that in August. If that goes through, we'd start construction on the 97 affordable units that are being built on 3 of the city's properties. Then we have the other 6 properties or 7 parcels that we have for more affordable housing that's out to RFP right now. I think that's all I can think of.
Which is fantastic. And Thomas, do you want to talk a little bit about Open Doors Acute Care Program?
Yeah, absolutely.
That's relatively new, isn't it?
Yes. So along with our van goes lots of different places and it's there on specific days, but that's never enough care for folks. And what we've also done is it's for all open door patients, but it particularly has been helpful to those who are experiencing a lack of housing. We've opened an acute care center. So 5 days a week, we have one of our clinics. It's one of the ones that I actually oversee. It is there with just nothing but walk-in visits. And we also have a vehicle which we're able to transport people who are experiencing homelessness, and we're able to get them there to the appointments so they can get seen for problems. We can get them into engagement quicker. They don't have to wait for the van to show up, say, on Thursday down at St. Vincent's or at the Grove in Arcata on a Wednesday, that we can actually get them to a place where they can begin to get care. We can get them hooked up with both medical services as well as the beginning of mental health services, hook them up with other partners within the community. We have various supplies, food and other things, first aid kits and other types of things that we're able to give that person to help them be a little bit better equipped and a little bit more comfortable while they're experiencing houselessness. We work with community partners with people, particularly if they have a health condition where they might need to be sheltered for a little bit while they get past it. Wound care is a real example. If someone has an abscess or another type of wound that needs ongoing care, they need to be sheltered while that's healing in order to not get further infections or utilize the ED. And that acute care center is the core of that. Along with that, we've been really beginning to experiment with a different kind of outreach. It's growing across the United States. It's growing here in California, which is called backpack medicine. And it's really possible for us thanks to it's amazing how these things are everywhere and you can kind of be everywhere now. And what's really cool is thanks to COVID, you can see a provider through one of these, and that means we can bill for a visit and actually sustain our services. Because as much as we don't want to be about the money, it still takes money to pay people. It still takes money to keep the lights on, buy bandages, buy medicine. And so we're actually able to reach out and send professionals to where someone is who maybe can't get to us. A recent example, we worked with Department of Health and Human Services. They reached out to us. They had a person identified who had animals, had other reasons they couldn't make it to where we normally do services, to either our clinics or where the van was. So we sent a nurse and a medical assistant out to them. That licensed RN is able to do things under the auspices of the provider they're talking to and under their license, and we were able to bring medical care and wound care to that person there. So rather than being separated from their animals, because the last time that they had this wound care problem, they went to the hospital, their dogs were impounded, they were separated and so on, and there was a real challenge around that for this person trying to put back together what life that they had. And so they were very unwilling to go get help, and they were at high risk of ending up in a worse place. And so we're starting to do outreach medicine into the places that are harder to reach. So we're expanding that as well. Open Door has also been expanding its case management services. We actually have have a social work intern program, and we have case managers that are joining Open Door all the time, as well as expanding behavioral health. And we now also have telemedicine behavioral health, so you can talk to a counselor, work with your mental health issues, and we can bring you to one of our clinics, and via telemedicine, you can sit with a behavioral health provider, and we can do that regularly. And I actually oversee the clinic that is specifically doing those services as well. We're also adding more psychiatry personnel to begin to really try to work with folks that are having those challenges in the community. The county mental health program is doing everything it can, and they are not enough by themselves. The county, the city, everyone is putting in their best effort, and so is Open Door. So we're expanding our mental health services, recognizing that this is a need, and particularly one that affects the homeless. And so we're doing that also. And we're looking to hopefully continue to expand our partnerships with everyone. Again, just recently the city has worked with us about bringing our van into multiple locations. Partners like HA and Arcata House and others are constantly working with us to coordinate events and other ways in which we can reach out to people.
And I just forgot another big, which should be a big thing. We have a Coast Guard building that's for the commercial. It's very much so in the heart of Old Town. It's going to become a substation for CSET, and so Sergeant Omi and his staff, I don't think they're going to bring Lenny down there, are you? Poor guy. Anyway, so there'll be a new station down there with all of our CSET, so they'll be right in the heart of Old Town. There'll be another section of it that'll be for our uplift and care program, so that we'll have a more centrally located spot for our staff in Old Town.
As far as, go ahead.
Just to be clear, when I said, our acute care is open for Open Door patients, if you're homeless and you don't have a provider, we are your provider. You already are an Open Door patient. Just come to us.
As far as the rescue mission goes, and what I think, what was the question again? What services are being expanded?
What are some new services in the area is kind of what I'm taking.
So with the rescue mission, we have a capacity of 35. That's for women and children at the Women's and Children's Shelter. We recently went through phase 1 of phase 3 of renovations, which, stay in prayer with me, y'all. It's supposed to open next week. We've been waiting. The city has to sign off on a couple more things, and then we'll get the bottom half of our building. But when phase 1, 2, and 3 are fully complete, we will have a capacity of 70. So we will be doubling our capacity, but we are supported off of the community and its donations. And our main entity is the thrift store, which provides funding for our facilities. we're raising money for phases 2 and 3. So right now, we are completely ADA compliant now. Once the back part gets open, there's ramps throughout the facility. We have an ADA compliant stove. So if you're in a wheelchair, you're able to cook for yourself. ADA compliant bathrooms, changing stations, anything that you could think of that you would need to be ADA compliant, we have officially complied with. Yeah.
And after phase 1, aren't you capacity going up to 40 something now?
So phase 1 will bring us up to, hold on. 43 to 47, depending on how they fit in. So with the families and everything included, we will be able to serve up to 47. So we'll add a little bit more with each phase.
How many are the men's rescue mission?
I don't have nothing to do with them.
So
They have a whole nother building. So there's I think 60 over in one building, and I think the other building can hold, I think they can hold up to 120 something, right, Lenny?
Yeah, I was during when COVID hit, I was doing daily calls actually with Kristen, with Brian Hall, and with the manager at the men's side, and they've never reached capacity on the men's side ever.
Yeah,
and I'd get daily numbers. So the good news is for Kristen's side, when they max out, so based on our data, about 70% of the homeless in Eureka are males, 30% are females, and so based on our numbers, my estimate based on our actual data is between probably 300 to 350 homeless in Eureka at this point. Would be my guesstimate. Maybe 400. We'll see next year's survey, but it's likely that when they expand enough, we probably have enough beds for all the females that are actually on the streets, which is huge for us because they are the most victimized.
Yeah, and also with that being said, whenever we reach maximum capacity, the city has rewritten the policy on our overflow shelter. We used to only be able to activate overflow if it was extreme weather. Now, if we are at capacity, the city has written to where we have 25 more beds available at St. Vincent de Paul's. So say we house, we can house up to 47. That 48th person, the city's willing to pay for somebody to go and oversee an emergency shelter. And I'm thankful for that because we utilized that for a good month and a half during the extreme weathers because we were at capacity. There wasn't packing any more people in like sardines in any way, shape, or form, and especially trying to conform to the COVID regulations of keeping people 6 feet apart and masked in communal living. That was a challenge in itself, but we did it. And I think we were able, through the whole COVID pandemic, we were able to 3 cases of quarantine is what we had to do through the whole pandemic. So at the women's shelter, we did good. Yeah, go to the Eureka Rescue Mission thrift store on Clark Street and Broadway. West Clark Street and Broadway. That supports both of the facilities. It helps to pay the water bills, the light bills. If you have anything to donate, there's certain things that they take and certain things that they don't take. You can always call up there or look online. We have a website at eurekarescuemission.org.
Thank you. Next podium question. Yeah.
My name is Colleen. I'm a retired nurse practitioner who worked with the Veterans Program for many years. And as a result of that, I saw many dual diagnosed folks and had a long-term look to see what works and what doesn't work. And what does work before you're ready to go into therapy is a strong peer support group. Vets Helping Vets worked. That's the only thing that really had lasting effects. Okay, how does that relate to our progress here? I want to say, first of all, I cannot believe the amazing blessed angels that we have in this community. Open Door. How did you ever get to be who you are? The Mission, CSET, the MIST program, the Uplift program. These are amazing people who staff these programs, and we need to be really proud of that. And yet, our problems are increasing with homelessness. So I want to take a little bit of a different tact about addressing a problem that flies under the radar normally, and that is staffing. There are always vacancies across the board in all of these programs. There are always pleas for more psychiatrists, more doctors, more social workers, and so on. And I believe that there are local answers that we need to expand on and create coalition relationships with. And that is College of the Redwood, Cal Poly. There's a number of training organizations who are up for this. I've worked about the past 10 years in various kinds of volunteer programs, but I had the enormous privilege of watching these folks on the street. I had the horror of knowing someone who died in a tent. I had I don't know what I would call it, such a blessing of walking a lady 2 blocks who was immediately put in an ambulance by the Open Door Mobile Clinic and transported. And there are many problems, but there is an answer that we have not looked at seriously. In the program that I worked with, the requirement for hiring, I was a volunteer, but the requirement for hiring was these people had to have lived experience on the street. And we were blessed with a pool of people that we found who managed these services. It takes an enormous long time to get trust from houseless people. But if you have that experience, you walk in with some creeds. Why don't we have a widely expanded educational program to get these peer counselors some credible background in theory matched with their experience? It's a real burnout job because it's a tough job. It's a really tough job. But DHHS all the time has vacancies for helping personnel, and so does every other agency in town. So why don't we step it down to the personal level and get this kind of peer relationship program working among our local educational situations? That's all I have to say. Thank you for listening.
Thank you.
So Jacob may need to help me a little bit on this one, but from a peer perspective, the co-pilot program that I spoke of earlier is one of those programs that we started and implemented for that purpose. From our standpoint, from our social services programming, I can unfortunately not say this for EPD, but staffing has not been an issue. We do not have any current vacancies for Uplift or CAPE or CARE right now. We'd like to have more money for them to have allocated positions, but there's no vacancies right now. I do know that Jacob's been working with Cal Poly on an internship program with their folks there. The contractual part of it has kind of been a sticking point, but we've always worked with Cal Poly on internships, not only with our Uplift program and our more social services program, but with community services and public works and other things. So we do work with them on that. CR, we've been trying to work with them, and I meet with Dr. Flamer and have those discussions. They don't have something in place right now currently, but we're definitely trying to pursue that as well.
Yeah, I'll hit on staffing a little bit. Obviously, our staffing across the country for law enforcement is down significantly. My opinion is the unintended consequence of the past 3 years, where you demonize the whole group. You're going to lose good people that want to come into the profession, and we're seeing that drastically. Even if we're giving sign-on bonuses or we're doing...
Lenny is changing it one day at a time.
I'm trying to. Just got to stay around for it. But, even when we have, signing bonuses or whatever, we're just not seeing applicants. There's days I'm like, why am I doing what I'm doing still? I could probably do something else with less stress, less animosity towards me, and probably make more money and have a lot less stress, which would be the big part. But yet it's the right thing to do. I love what I do, so I keep going. But for us, we have one vacancy with CSET right now. We may have, we haven't discussed, when we had 5 people on the team, one of them was covered by Measure Z. So I'm not sure what's going to happen with that position right now. But that gives us a total of 5. But right now there's 3 officers on the team, supplemented by our professional staff as well. As for peer coaches, I know that, or I'll talk about Cal Poly Humboldt now. Connie Stewart was working on a program about navigators. So I think it's still in the works to actually train people at Cal Poly. They want to create a new job classification called navigators to actually do this across the state. So that is a discussion also with CR as well. So I'm not sure where that's at. I haven't been to a meeting in a while about that, but I know there's discussions over the past couple of years about that. But yeah, staffing's not good. And everyone's impacted, especially us and the county. But our social services with CARE and with Uplift, when we have had those openings, we had a lot of applicants. One, I think the culture of our teams, that we want to really be inclusive, have people engage with us, cut the red tape out a lot for government, and allow them to do their jobs correctly and with very minimal interference, which is never good. So.
And I would just add that the mental health field has embraced the peer model about 10, 15 years ago. We started embracing it. And so I don't know how many peers there are employed by the county, but I bet there's maybe 20. I wouldn't be surprised, somewhere up in that area. And then we also use what are called parent partners. And they're kind of peers that join with parents who have children in the mental health system. And Leah Nagy here is very involved with that program. Thank you for coming, Leah, and all the work you do with the parent partners. And so yeah, it's a great lived experience. I worked at the home program for many years, and I always wanted lived experience. When that was one of the most important attributes that a candidate could have, is having made really bad life choices and then pulled themselves out of it somehow. Thank you.
And on the front for Open Door, yes, particularly in healthcare and particularly up here, the challenge of having enough medical providers, enough medical assistants, enough nurses, and enough of the personnel to do what is our core service. Our primary reason for existing is to deliver healthcare and those social services and other aids that are attendant to that. All of our sites, all of our clinics actually help the homeless. All of our clinics work with those who are challenged with mental illness, and we've been doing a lot to try to make sure that we're staffed up. One of the things is we have a relationship with CR, for example, turning out medical assistants, but they can't turn them out fast enough. So Open Door has developed its own internal program, literally employees who come and start at the front desk or in other departments and decide, hey, I think I'd like to give people shots and help people and check their blood pressure and do all that thing. We train them. They go to school on our time, on our dime, and that kind of thing. We've created that program as both a career path forward, but also to produce more support within the community. We have residency programs. So when providers get out of school and they want to really get their learning down, they go to residency programs. It's been shown that providers will go to work, generally speaking, within 250 miles of where they did residency. There's no residency program from more than 250 miles from here. So Open Door worked with St. Joseph Hospital to develop a family medicine residency program for MDs and DOs to help bring them to the area. We're already moving through our first cohort. 3-year cohort is graduating, and several of those people are staying in the community, both with Open Door and with other providers of care. On top of it, we also created a physician's assistant and nurse practitioner residency program, and 50% of every one of those cohorts, those people have stayed on and become residents of this area and become providers who bring care. In addition with that, with the peer support thing, it's well evidence-based that is a way to go forward. And what you're really talking about there is a form of community health worker. And so within our own context, we've been trying to find ways to make that sustainable. We recognize the value of having people who have lived experience working with folks. I can tell you on my team, the team that works the most directly with the homeless and most directly with folks experiencing mental illness, I'll tell you what, when you interview with me, lived experience goes a long ways towards getting a job. We actually, there's a ton of us who work at Open Door in every department who have lived experience with these things, and Open Door values that. A criminal history doesn't bar you from working with us. It doesn't bar you from being part of our scene. But along with that, there's a very large bucket of things called payment reform that's happening. So traditionally, people go to the doctor and the doctor does something which may or may not work and you get paid. Well, no one thinks that that's really how it should be anymore, and they're moving towards something else, which is paying us based on outcomes and doing other measures that really help people. And a big part of that is something that's called the social determinants of health. They've got now a new updated acronym for that, but that's the one that's the most descriptive. And it really talks about the fact that it's really hard to have health care when you don't have enough housing. It's really hard to have good health when you don't have enough food to eat, and it's nutritious food and so on. And so it's addressing those, and part of the money that's coming down from the state that is to support health centers like ours is there's a pot of money called CalAIM, and one of the goals of CalAIM is really working around those social things and trying to help us find ways to incorporate people like community health workers, people who are much less expensive to the system but actually bring more value in working with individuals to work through the things that they're doing. And this most especially includes the homeless. The folks that work on the van specifically target this idea and are there to be advocates and to work with folks and to try to connect them to their peers who have experience and who have moved a bit forward. And we do that regularly as a sort of unincorporated part of our program.
And to add on to the CalAIM piece too, part of that benefit is also revamping how mobile crisis teams are funded and how many mobile crisis teams there will be across the state. And a huge piece of that is actually promoting that these mobile crisis teams have to be have different types of positions. So it's not just a bunch of master's level clinicians running around. It's also case managers, it's peer coaches, it's EMTs. And they are really emphasizing to diversify that staff, peers being a big part of that. So there's definitely changes being made. And I think it's a classic situation, Tom, as you mentioned, 10 to 15 years ago, they started adopting it. I think it's that classic research to implementation lag, right? Stuff that was researched and found evidence-based 10 years ago, it takes time to get it implemented and get it mainstream. And I hope that's where we're going. Next question.
So I'm Leah Nagy, and I'm actually president of NAMI Humboldt, and I'm actually on the Waterfront Recovery Center board with Dr. Bryant. And, and I actually work with Humboldt County. I've been a family liaison for like 30 years. And Tom mentioned the Parent Partner Program, which finally we got something into the system that supports families. And these are parents with lived experience, maybe being homeless or substance abuse, losing their kids. And now they're supporting other parents in our community. I do have a question at the end, but I just wanted to mention a couple things, maybe more than a couple things. First of all, thanks to the panel. I'm so moved by your life experiences. I think your stories are so amazing, and you reinforce the idea at the end of every support group, which I do 3 a week. We say we will never give up hope. You guys are all shining examples of the hope that is here in Humboldt County, so I want to thank you. I want to thank everyone for coming that's obviously interested in our community and in our homeless individuals. This has been a little emotional for me. I lost a nephew, my twin sister's son, to mental illness and substance abuse. He was homeless 15 years and died in Arizona. And then my own grandson is now in prison due to schizophrenia and drug use. It's interesting how mental illness, homelessness, substance abuse, we're talking about this a lot of times the same person. I think 70% of folks admitted to some violence were co-occurring or had issues. Housing is super important, and I tell family members, if you can buy a tent, or if you can buy a house, or you can buy a trailer or an RV, try and own something that your homeless person can live in. Because, as Kristen said, any little thing that happens, you may be evicted. So I actually got an apartment for this amazing grandson that I have. And he was only able to be in that apartment for 2 weeks due to schizophrenia, and was immediately kicked out. On the other hand, one of my own sons, I've always had a house for, either on my property or another house. What's interesting, my son's delusion was there were ghosts in the house, and so he purposely made himself homeless and slept on the beach. So no matter what families do to try and keep someone with mental illness from being homeless, sometimes there's nothing else we can do. So I appreciate the community trying to work and solve this problem, and I'm glad that you guys are here. The other thing I just want to mention briefly, and we haven't really mentioned a lot about it, but family members often say, I'm so glad my loved one is in jail. They're not homeless, they're getting fed. There is opportunity to take medication, if they agree to it. In the case of my grandson, it saved his life and it saved other lives, and he cannot be, free to just be mentally ill and do drugs, because he can be dangerous, and he's the sweetest person when he's not involved with drugs. Anosognosia, we mentioned that, is the lack of insight. So most of these people don't have the insight. As you guys know, I'm not sick, I don't need help, which is a great book for folks to read. But that's part of the problem. So it's complicated, but I want to thank Kim and everybody else for, let's talk about it. Let's get it out in the open. And, like Bambi, in the movie where the little skunk flower says, if you can't say something nice, don't say anything at all. If you don't feel you can do something for the homeless, please don't do anything, but if you do feel you can do something, maybe buy him a sandwich. The other day at the mall, I saw a young kid yelling, and he didn't have any trousers on, walking across the Bayshore Mall parking lot. I just called 911 and said, can we get the team out here to give this poor young man some help? Just anything you can do that will help improve our community and our homeless population. So I want to thank you guys. Here's my question. This is a real deep question. You may or may not want to delve into it a lot, but what advice do you think family members should know or should have? That's a big question, I know. Okay, have any of you have an example of how you help family members? Like in my support groups, a lot of times they need help with resources, or they need help. They don't even know what ROI means or what a 5150 is. So if you have any actual examples of how you helped a family member, you might want to share it with the audience. I don't know.
Just a reminder to our audience on Zoom, if you could keep your mic muted, that would be great.
That was funny.
And
that was a good one. Anyway.
And Leah,
yeah,
Leah,
that's
what
me.
I'm kind of hearing is if family members have someone in their family who is homeless, what advice or what guidance would be given to that individual? Does that sound right?
Yeah, that sounds fine.
I would personally say that the shelter is a great starting point. As I said, I came from 19 years of addiction, 17 years of homelessness, and 13 years of human trafficking and prostitution. I was able to go there. It is a solid foundation upon which to rebuild. It's a structured environment where you're able to have guidelines and rules that are to be abided by, but there's flexibility. We deal with a lot of mental health at the shelter, and that's something that a lot of the other homeless agencies may not be able to deal with, like the Arcata House Partnership and Betty Chin's. I know that they work well with CSET, and I don't think Arcata House Partnership partnered up with you guys too. Yeah, so we all work really good with the local agencies and stuff. If everybody could just stick together, I think that there would be change.
What are your hours? I mean, so I can share with families between this time and this time every day, someone can go to the mission.
So 24 hours a day is the mission's hours. From 9 to 2, we do community showers and clothing. At 6 o'clock at the men's shelter, we do a community serving of food and chapel services. And then at 7 o'clock, the women come over to the women's shelter to intake. So they eat over at the men's shelter. They come over to the women's shelter at 7 o'clock to intake. The next morning, they'll go to breakfast at 7 o'clock, and then they'll come back and meet with me to see which part of the program they're going to fit into, whether it's overnight shelter. There's some people that just they can't be there all day. It would be too much for. So we have overnight shelter. We have the homeless to housing program, which is for the families. That's where they have their own room that they're given for themselves and their children, and they're able to go. We work with them around their work schedules, around their school schedules, around like basketball. If any of the kids have any sports or anything, if you need. So yeah, that pretty much covers it. 9 to 2 for showers, 6 o'clock for dinner and chapel services, and 7 o'clock for intake.
All right, thank you.
I just wanted to double down on something that Kristen said. When I first got into this social services stuff back in 2013 and 14, it was amazing to me, the infighting amongst the agencies that were fighting for funnies. And I'm not going to name you, but just it has changed drastically over the 7 years or 8 years that I've been doing this, to where the partnerships are a lot more collaborative, and they're definitely more open to discussion about what programming is going on and what people are doing. But when I first started doing this, it was a lot different.
I remember
Yes.
those days. A little cutthroat.
Yes.
I would say, in answer to your question, a couple of things. In healthcare, of course, we can't, like, your relative is a homeless person. You can't just come and talk to us and we can talk to you about them and their care and that kind of thing. There's a thing called HIPAA, and we're required to I can't even say, oh yeah, they're a patient of ours. If I see you dropping them off, I might be able to say that, that you're actually in attendance with them and they're there to consent for that conversation. But otherwise I can't talk in those terms with people. In working with families, we certainly direct them to all the agencies that we've been talking about today, to the agencies and resources, to 211, to all of these things, to try to help people understand what's out there and to know ways in which they can work with their family. But one of the things that I would put out there very much as advice to people who are family members of people who are struggling with homelessness and may also be struggling with addiction and mental illness is this. We all want to feel that we're empowered to save our loved ones. And I wish that was true. But there's many aspects of the problem, as we've been talking today, that we're powerless over as individuals. That whether it's the thing in the systems, whether it's the thing in our individual family member, whether it's their challenges with addiction and mental illness. I couldn't get help with my addiction until I could get help with my addiction, until I had reached that moment. I was a crazy person till something happened and help became possible. Don't give up hope, but also have healthy boundaries for yourself in helping your loved one. I know from personal experience, you can eat yourself up and destroy yourself trying to help other people, who aren't in a position because of either what's going on in the world or what's going on in them to be helped at this moment. So you can do what you can, and then also know that there's things that aren't given to you to do, and you can still be there and be loving and accepting of them, and then try to move forward from that.
Good advice, Thomas. I'll take it to my support groups. Thanks, you guys.
And I just want to add that the love of family is really important for people to not feel alienated and abandoned by, and homeless people often do feel alienated and generally pretty much always feel alienated and abandoned by society, and often by families too, because they've worn them out. It's exhausting sometimes having a sibling or family member who's struggles with addiction or mental illness. So, try as best you can to love your loved one despite their problems.
All right, thanks, Tom.
Thank you.
I had a couple things that I wanted to talk about today. Mayor Burgle, I've never voted in Eureka. I've been a business owner and worked down here for a number of years. I currently live in Eureka now. And I just want to let you know I'm so proud of the people of Eureka and you. Some of the stories that I have heard from my houseless neighbors, they tell me so much about you. It's really important for people to know that. Other members up here, thank you for being here. I might get choked up, sorry. Over the past couple months, I've been working on a housing documentary project. I've been going around talking to various community members throughout the county, people from the houseless community, people from policymaking positions, pretty much everybody. Kristen, yes. What you said about having insecurity, even though you're a renter, until you have your own home, there are more people now feeling that than ever before in this county. Countywide and with municipalities, we really need to recognize that there is a wave of houselessness coming if we do not take care of the skyrocketing prices. Part of that, of course, is increasing our housing supply, but also it's really expensive to do it, and the rents that we have to charge for these new units do not reflect what people make in these communities. Gentlemen, just what you said about being a good neighbor, talking to the people that you might see that make you feel uncomfortable. I've been working to do that. Like I said, I've had a spot in Old Town for a couple of years now, and taking a moment to talk to people on the streets, ask them how their day is. You end up realizing that these are your neighbors. They care about you. Sometimes they have a bad day, but they also are people. And Officer Leonard, one of the people that I spoke to during the course of this project is a gentleman down in Redway. Pastor Chris at Redway Baptist. I interviewed him about his story and how he came to be at Redway Baptist overseeing the warming program. And in the process of interviewing him, I said, can you give me an example of a time when a stranger did something that really helped you? And what he told me was that when he was a person who was houseless in Eureka, struggling with addiction, there was a time when he was picked up by a police officer and he should have been brought to jail, but that officer brought him to Semper Virens, and then he ended up at the shelter. And it was a couple-year process for him, but now he is in charge of Redway Baptist and is just doing outreach programs to help the people in Soham. You have hard days, but you need to know that when you do things like this, it makes a huge difference to our communities. So essentially what we're doing here is, as a community, we're working to define what the minimum is that people are entitled to. We have food stamps, we have some healthcare things that people are entitled to. We don't have anything that defines what level of shelter people are entitled to. We don't have anything that defines what level of sanitation people are entitled to. And while you've discussed, Mr. Slatterly, about how the public porta potty systems and dumpster systems have run into challenges, it sounds like the dumpster challenge was that citizens who it wasn't intended for abused it, so it was taken away from the citizens who it was intended for, who it really would have helped, who it really meant a lot to. So I'm sure we can find a way to make sure that those people are able to have access to some type of sanitation or refuse removal. Most of us have access to trash cans, dumpsters, regular pickup. Our refuse vanishes. We take that for granted. People that live in encampments do not have that. People that live in encampments often are picking up items that they find in somebody else's trash. It's essentially trash that has already been paid for to be brought to the dump, but they are not able to take advantage of that. As far as access to toilets and sanitation, you may say that it had to be pumped out 3 times a week. To me, that sounds like it was being very well utilized. To say that it gets dumped over, to me, I say, let's figure out a way to make it harder to push it over. if you'd like, please come with me and let's talk to some of the people in Old Town or other neighborhoods about how they take care of their needs. To say that the dumpsters didn't diminish the number of poops on stoops, that may be true, but it definitely diminished people having to use bathrooms in places that were not bathrooms and then clean up after themselves without proper sanitation access. So as we go forward, if we could just discuss where we think defining the minimums for our neighbors and our community is, and how do we achieve that? So, thank you.
Panel, you want to kind of jump on that as far as the minimums on, you know, what like, I guess, what is the standard that we should be aiming for as far as
like I said, I think that standard needs to be basically shelter space. I think that standard needs to be a running toilet and a running, facility. Our goal as staff, and I believe we're supported by the elected officials, is to make sure that for whatever head count that we choose to use, that we have enough beds for those places to go to. And that bed is not a tent, and that bed is not a 5-gallon bucket. It's not those things that they're typically used to. And I think that we can get there. I think that we've had the capacity that's getting much bigger than it's ever been. We're putting the money in order to get there. Yes, there can be interim solutions, and we'd love to sit down with folks and have those interim solutions. I will say that from every time we go out and we have interactions with our outreach workers or with CSET, we are handing them bags, and we continue to do that. Some do, some don't. The cost was the issue before when you have 38, 40-yard dumpsters, when it costs you $175 a ton to dispose of it. It has to travel that far. It was cost prohibitive. We could not afford that after that 4-month period, and it was way too expensive. We don't get free trash. We don't have our own landfill. We have to truck it 178 miles away from here. So that was a cost prohibitive. But I think the standard needs to be that, just like the Boise case wanted, if you don't have a place for them to go, then you can't enforce your codes. And I think that that's what we need to strive for, and I think we can get there.
I think, in speaking to minimums, the idea that shelter is a minimum and something that we should maybe begin to look at as more of a human right than the advantage of those who can afford it is really important. And I think something was said powerfully about the coming wave of houselessness. The United States is facing this as a whole. This is actually a recognized economic fact about the United States, that the cost of housing versus people's income is continually increasing. And if that happens particularly in areas of low income, like Humboldt County and other rural areas, it will have a disproportionate impact. Where homelessness has typically been looked at as an urban problem in the past, it is rapidly shifting gears and becoming a problem and a big challenge, particularly in communities like ours, in rural communities where there are less resource and where the cost of housing is really actually going up disproportionate to the increase in revenue from jobs. So I wonder if one of the minimums becomes that there are some sort of standards around rent control. Those things have been tried, though. Places like New York City and other places, they have not been particularly successful. Economics is a force, just like physics, just like gravity and things like that, and it can only be manipulated so much before it doesn't deliver. And so I don't know whether we can do that, but we do need to look at the fact that pretty soon more and more people on the lower end of the scale in our community will not be able to afford to maintain their housing. They're only one paycheck away from losing it right now. They lose their job because that business closes its doors or some other thing changes, and then they will be houseless because their landlord will evict them because they can't pay the rent. And so that's coming. And so I wonder if that's not a standard, but I agree. Shelter as a minimum standard for human decency, access to toilets. Try not having a toilet for a while. I actually had a situation in which the plumbing in my house was bad for about a week, and it was, there was a major repair that needed to be done, and I was literally going somewhere else to go try to find a place to go. And I'm a resourced in-house person, and so can you imagine the challenge of having that be your regular thing? And I think the more that that's offered over time, that will have an impact on that. I also think that emotional support might be a minimum, because it's really hard to engage and move forward from where you are. As was said, it's like homelessness, it gets its claws in you, and it's really hard to move forward. And when you wake up every day discouraged, knowing that today will be just like yesterday, you won't have, people will tell you no, you have nowhere to go, you're not wanted, you get that message really clearly, and no one's going to hire you. No one's going to change anything for you, and it's going to be the same again today. That's one of the most demoralizing things that there can be. And so maybe emotional support through the trauma of being housed. There are those for whom this is not their story, and I want to recognize that, and those are the people that stand out. They're the ones that often come to the attention of law enforcement. There are people who have a different agenda in houselessness, but we shouldn't confuse one small subset of people with the population at whole that is experiencing homelessness and been victimized by it. There's a very big difference there. It always, what do they say? It always takes one bad apple, right? It makes the whole thing look bad. But we should remember that that's what it is. Just like with the rest of the population, the minority of people are bad actors. The rest of them are just trying to get by.
Just add that homeless people aren't any worse than any other people, but they are a lot more desperate. And desperate people do desperate things sometimes, but it's not that they're bad people, and they work hard. To be homeless, it means that you're working 7 days a week, probably 12 or 14 hours a day, just to survive. And it's really hard to try and do something that's going to benefit you 2 weeks from now when you're trying to survive today and barely getting by. So anyway, thanks.
Thank you, panel. Just looking at the time, I want to remind folks it's about 4:00, and I'm seeing that we have 4 other people here. And so I do want to be able to cycle through, but I just want to make sure that we allocate time appropriately. So if we want to kind of maybe condense comments and get to the questions, and then we can come on through, okay? So next.
I'm Nezzy Wade, and I'm really happy to be here. I'm happy everyone is here, and I really think that this kind of conversation needs to happen more often, much more often. And I do appreciate your comments, Miles, that when you started 7 years ago or whatever it was with the continuum of care, and the different programs were really siloed and they weren't really working so well together. And I think that is true, that there are more things that are happening now than before, but I also think that the collaborations need to be broadened, they need to be deepened, they need to include programs that have previously been stigmatized for whatever reason, just like people get stigmatized. There are programs that have been around for a really long time that really need to be revived. There are brand new programs that need to be uplifted. There's a lot of things that could be happening. I have a couple of questions that I think are points of confusion for me. First of all, I don't know where it originated, but the idea of choice that Harry brought up. Choice is something that inoculates one against the realities of being a have-not. So if you want to be brought into some place that's going to identify all of your shortcomings and everything else, a lot of people aren't going to make that choice. And that's something that, we have to keep in mind also. It's just like rejecting the people of status because you aren't going to have that status. You're going to go the other way. I think those are important ideas, but community is the thing that underlines for me everything that's been said. How you are supporting someone emotionally, socially, medically, and everything else. And one of the things that we talk about is how people can be brought into a place of shelter or someplace that's comfortable where they want to be, because it's going to support them being a community member and being able to vest in some place. Concerns that I have, and AHA is my organization that I affiliate with, and we have had models for sanctuary camps or legitimate camps that can be places of shelter. And we now have ordinance in the county that would allow safe parking, safe sheltering in tents or small structures, but they don't go deep enough. They don't make it possible to do on an easy basis, and it's limited to who can do them and all those kinds of things. We need those collaborations that let a whole lot more people participate, and people will be able to help one another. You know, a community does that. You mentioned people who were growing up and then didn't have the person in their family to support their mental health issues. That's what a community can do. So having and building communities where people can reside, and whether you call them shelters or housing or whatever you call them, they're places that people need to have a domain where they can live and breathe and engage. And if you want to focus on peer stuff, that is entirely possible. And when we have a village, believe me, they're going to be going to all of you guys, finding things to do, as well as building and supporting a community that they're living in. It's going to be a wonderful thing. And CR can support you in having a peer program. My first job when I came here in '78 was in the New Careers.
Nessie, sorry to interrupt. I want to make sure that you get your question out there.
Okay,
I appreciate the background, but
Sorry.
I just in the interest of time.
That's part of it. But the question I have is when I hear you talk about managed encampments, my concern is, what does that mean to you? And is that just a place to send people to be when they get swept or when they get moved out of an encampment, someplace for them to be, so that relieves the responders of the responsibility and somebody else is there to take them? Or are we talking about actually building a community where people can be safe, or many communities where people can actually reside and thrive and continue to move on from there? Because I know what managed encampments are like in some places, where it's just a place where people, police, first responders can take people to be able to be in a place that is safe, but it isn't for the arrangement of living beyond that. So I want to know what you mean by managed encampment and what that looks like to you. That would be really helpful.
So from the city standpoint, a managed encampment is no different than a shelter. It would be just like the Eureka Rescue Mission or anything like that. There would be guidelines that would be administered by somebody that oversaw the camp. From the city's perspective, there's only two limiting factors that allow us to do this. One is the zoning. So if the property is zoned appropriately, we can do it there. The other is the building code, and it's Appendix AZ of the building code that regulates emergency shelter cabins. You can have membrane, which tents would be. They need to meet a certain guideline of being 4 inches off of the ground and 6 inches curbs around them. There's a lot of different models up and down the state that have done this, and that also has to be 6 feet 8 inches high and has to maintain a temperature of 60 degrees. That temperature of maintaining 60 degrees could be difficult, obviously, in a membrane tent, but these are state regulations, and we're not going to recommend to our elected officials to go against state law. But there has been many communities up and down the coast that have met those guidelines. How the camp is managed is going to be a decision made by our elected officials. We have discussed in the past the encampments that we had for the rotating encampments, and staff would not be in favor of that. I think there needs to be some sort of reporting, some sort of responsibility to your neighbors, and some sort of responsibility to the community members that are there to ensure that they're safe. And so those would be the things that we're looking for when we're looking at a managed camp.
And is there a residency requirement or the amount of time that someone can be there?
No, there is not. Just like our shelters, we don't say, show us your water bill.
Be in a program to stay?
They do not have to be in a program to stay, just like the rescue mission.
Yeah, the other thing about managed is wraparound 360 services. So obviously, having SUD support, mental health support, housing support, employment support. So everything we get from folks from where they are currently to where they either want to be or where a better place than where they currently are. We want to have those support services as well. So that's when I think of, say, managed encampment, I agree with Miles, but we also need to look at getting people to the next step where they want to be in life.
Will they have to There's a requirement in the building code. I should have said that as well. The requirement in the building code is to have sanitation facilities, so they'll have to be at a minimum, shower facilities, restroom facilities, other things like that. No, drugs would not be a requirement.
So
they couldn't do them while they're there, but it's not like we're going to be screening.
I want to make sure that again we're conscious of the time, and so if you had questions, then we'll get up in line. But otherwise, we'll hold off on the audience. I think a big piece of that is the housing first model, right? And traditional housing first would be actual housing with a roof over your head and your own place. In the absence of that, some of these interim measures can be helpful. But again, you have to do housing first. If you try to implement mental health services or substance use services while people are still transient and they're going from place to place, it's really not nearly as effective as if you have a place to actually target case management. So from like a mobile crisis team perspective, if I'm working with folks who are homeless and who have mental health or substance use issues, I want a designated spot where they're going to be so that my team can contact them frequently, build those relationships, invite them back into the community, get them services. And so I think that even though, again, it's not the traditional housing first model, you'd have to stick along those lines where you get them settled somewhere and then roll in services heavily afterwards. Next comment.
Sorry. Can you hear me? Okay. Traditional housing first model did involve. Okay, can you hear me now?
Pull it.
Oh, okay, it wasn't. All right, good, I don't have to scream. Traditional housing first. A mental health clinician went out and asked people, what do you need? And they said, a place to live. They did not say a house, a 2-bedroom house or anything. They said a place to live. He used housing in the community and placed them in there with support. They were successful. There was a small minority that needed a place where there was on-site supports, but most people were placed into the community. As for shelters using the housing first worked and it housed people. Shelters serve a really important role in this. But if you have money, building housing is better than building shelter. I am so glad to hear that you are going to expand and that you're going to be able to do ADA. I've knocked on your door with somebody and said, come back. No, it's hard. So I'm glad that you're being able to expand.
Yes, ma'am. Thank you.
So when I talk about a campground, I talk about a housing first campground. And what is the difference? Tenancy. And I worked for 4 or 5 years in my 20s talking to people about tenancy, landlords and tenants. I am a landlord. I understand the problems and the benefits of tenancy. A campground with tenancy is a place where people can learn some of those rules and what needs to happen to live in a place under tenancy. I would prefer co-op housing. I would prefer that we built other forms of housing, but tenancy is what we got. So my question is, I sent all of you a sort of the legal support for this idea of campgrounds with tenancy. I also included that another piece of the puzzle, and that is that Eureka has done a lot in 2011, when I was in front of the courthouse supporting, allowing homeless people to be there against other advocates, Eureka already had a social worker working with the police. Pam Millsap came to the front of the courthouse, there was a problematic person in front that she worked with to get into shelter. He chose not to go, but he was a problem, and that was a problem we dealt with. So Eureka has a long history of doing the right thing, and you have made a lot of progress. So that's why I'm just hopeful that Eureka will again move forward and embrace the idea of using a campground. And even more than that, I hope that you will work with your county partners who have provided the city of Eureka, can I say millions of dollars in Measure Z funding? Yes, you can. No, you can't. I will send it to you. Over the years, you started, when did you first get Measure Z?
Total, yeah, total, that's, yes.
Thank you.
Yeah.
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 3 million?
Yeah.
2.5? Okay, but it wasn't, but anyway.
Millions. I don't want to get bogged down in the numbers piece. So
I have one more question.
Yep.
I've asked
Fire
two.
away.
Have I asked two? I think I asked, will the city of Eureka seriously consider what I've proposed?
I have said it from day one, 100% we support authorized encampments, but we need to follow state law.
And state law says that you have a shelter crisis declaration, and under the shelter crisis declaration, you can provide for modifications. It is true that there is a building code, an alternative building code that was enacted. But still, I bet if you wanted to do it it's 60 degrees, it's 50 degrees, not 60 degrees. There are ways to make them. There are ways around it, and you could, and the state would agree with you. So we can talk about that. The one last thing is, will you, Eureka, and Eureka Police, because you have played a vital role also, thank you for all the work that you've done, approach the county and work with the county so that it is a countywide system.
So we did work with the county.
I know you are working with the county.
We worked with them when we declared the emergency shelter. We worked with the county in the discussions about their safe parking. We continue to work with the county on all of those things. That's why they've been such a great partner and provided so much funding. I would say the county, from a social services perspective, have definitely given us millions of dollars above and beyond what we ever got from Measure Z.
And will you?
I think we got to cut you off there. I'm sorry. Okay. It's turning into more of a discussion than a couple of questions. So I appreciate the input. Do any other panelists want to talk about the idea of tenancy in an authorized encampment? As I think that's was kind of where some of that initiated. Before we move on. Okay. All right, next question.
I was going to say, how can I not be so proud and thrilled by all these discussions? It makes me so happy. And the thing is that it means I really don't have to say most of what I was going to say. So the question I would ask, because you say so much that I think is so important, and what I've been concerned about for the many years I've been witnessing the issue, is what I call the public narrative. And the public narrative, I think, can be so influential and also very dangerous. And this is not the way I had perceived you, but after this meeting, I'm going to change. And what that means is, when you see people who are homeless, you know, what happens is you often say, well, we have services. We told them about the services, and they won't use the services. So therefore, It must be that everybody out there is choosing to be homeless, and therefore I think the public sympathy, empathy for those people is low, and the judgment is very high. But I think that's just doesn't tend to be the case. And I was really impressed with the rescue mission, who are my heroes. And what I find that they have done is they respond to what the inadequacies are, and they respond to it. They try to address it for increasing their shelter, seeing if they can't be flexible with the low barrier issue. But the point I want to make is this, that and I realize I don't have a lot of time, but I think I need to bring it up. Justine Green, I think, can be a lesson for her, bless her heart. One of the things that I found out was that she did have an intoxicated level of methamphetamine in her system. And I talked with, the deputy coroner, Charlie Van, oh gosh, I'm going to tell his name. I don't want to embarrass myself here. Van Buskirk. And he gave me a clear statement to say, which was that just so we know, the reason I'm going to get to why we know, the point I want to make, because we don't have a lot of time, is I'm going to, here it is. You should.
What question are you looking to ask
The question
for
is
the
this.
panel?
Very good. The question is that what I think the lesson we learned from Justine Green and the other people who have died is there are gaps. And the gaps are because I don't expect a program like Eureka Rescue Mission to be able to deal with the people who have extreme, addiction issues, extreme mental health issues. So I talked to somebody, I want to quote him because his question is the one we need. I talked to somebody who works at one of the substance abuse places, and he said the question he has is, where do you send people when you can't help them, and how can we do something better? And that's what concerns me. What can we have? And I think one example, and I think Kim's talked about it, is like a wet shelter. And a wet shelter is set up to help people wherever they are in terms of their addictions or their mental issues. And I think we need an overall approach that says, let's get together again and explore all the possibilities, because I think you go beyond what I ever thought was possible. In all your programs, you stretch them out. But still, as someone said, they're the programs that people need to fit into. We need programs that people are met where they are totally without change, because that's kind of the way it ends up. And I want to make this pitch. I hope I have time. The thing that breaks my heart.
I want to actually. Sorry to cut you off. I want to jump to the questions.
Okay,
and
the
so
question is, there's two questions. What can we do so we explore to the best of our creative ability what some of the options would be so that people are able to go to these places when they can't go to the rescue mission, they don't fit in, or Betty Chins or whatever. And number two, I'm going to say it 5 times so you don't cut me off. Why the heck can't we give funding to AHA? Because I was a witness to them working with those people and doing it incredibly well. They had, let me give you an example. I know I'm going to get cut off.
I got to cut you off. Let's just field the first question. The second question, I'm not sure if anyone up here is going to be able to answer,
I hope we can.
other than the typical funding stuff.
Yeah, I hope we can, because it's so important. But anyway, go ahead.
Okay, yeah. So I think the first question that I'll pitch to the panel is what for someone who maybe we don't know what kind of help they need, where can they go, and how can we do that better so that there's kind of more of a no wrong door policy?
Yeah, and explore options that aren't existing now and try to create them. And what process will it take to do that as a community and as these organizations?
We discussed this a little bit earlier, but we are doing that. We do recognize the barriers, especially with pets and being couples. When we were having unusually low temperatures later into the season, we worked with the faith-based groups and was able to open up a warming shelter, and that warming shelter was supported by a warming center that was supported by our uplift staff and our EPD staff that would go and meet people at free meal, pick them up, take them to there, notify people, send out press releases, and then also when they were at St. Vinny's dining facility, would give them the information that morning and let them know that it would be open in the evening. We are expanding that, and we're going to be expanding that for the next winter season to other faith-based facilities, as well as working on a volunteer program to help staff those. And so that's one of the ways. Those don't have any barriers. Pets or couples are allowed to go there. As I discussed earlier, we're looking at a home key grant to do something similar. That would be a shelter space that would have 60 spaces available for folks without barriers. So there wouldn't be those typical barriers of pets. There would be a kennel for their pets, and we would allow couples to be there as well. And so those are the two things that we're working on. But the more recent thing is the warming centers that were extremely successful. We were anywhere between 10 to 15 people a night that were there, and I think we did it 6-7 nights. But it didn't start until later. Prior to that, as Kristen had referenced, we have the overflow shelter that's at St. Vinny's. It's up to 25 beds, and it's definitely 25. It's not 12, it's not 10, it's not 15. It's 25 beds that we've supported, that anytime there is a capacity issue at Rescue Mission Betty's, at all of our facilities, that gets opened up and we allow for folks to go there. And the city covers the cost of that.
I appreciate that, but I think I'm not getting, I'm at fault for not explaining it very well.
Well,
I mean, for the people who can't use those facilities.
Let me jump in too, because I think that another piece, for folks who don't have anywhere else to go and where maybe healthcare workers are stuck, the county's navigation center that they're going to be opening up is going to be an excellent day use area to bring folks to. That's going to be where a lot of targeted case management is going to be at. That's going to be where a lot of social services, mental health services, substance use services are all going to be there. And so that's going to be a huge boon to our community when that gets finished and opened up. And that's something that the county is putting together. That would really be a core component, for really this idea of a no wrong door mentality, where regardless of what someone is struggling with, they can be brought there, and then there's going to be folks who can help them navigate the system and get the services that they need. That's going to be a big one. And then, just in the interest of time, I want to bring one more person up, and then I think we'll have to cut it off there.
Well, I am a single mother, and I've worked really hard all my life.
Sorry, just real quick, can I get your name? And then do you want to tip the mic up towards you a little bit just so that we can hear you?
Yeah, I hate to say my name is Karen. Right? But I've worked since I was 12 years old. And I've also worked security, so I hear these homeless people telling me they don't want help, that they don't want to go to homeless shelters because they, have to be sober, and they have to they don't want to sleep with other men that snore in a home. And I'm angry. I'm a single mother for 30 years, and I had a person that quit paying their rent for 2 years, and I called and I tried to get someone to help me. Right? It's over $10,000. Who's going to pay that? Right? Who wants to pay that for me? Right? It's unfair. It's bullshit. Right? I mean, if they want to help themselves, they can.
So, Karen, I want to be real careful not to stigmatize, and I want to be really careful to be respectful of all the folks who aren't here today who we're actually kind of talking about. And I also want to be interested in our time in that. What is the question that you would like to pitch to the panel right now?
The big thing is, why are you taking downtown? I'm a business person, and you're taking the downtown and making it into a homelessness shelter with the parking lots in the city? What are you thinking? What?
I'm not
Why
sure.
are you
I'm not
doing
sure
that?
I understand the question. That was more of an accusation of actually something that
it's not
only
an accusation.
I can answer that.
Well.
I can answer that.
accusation.
Karen, I can answer that. So I want to be clear that the parking lots that we're talking about are not homeless shelters. They're not transitional housing. They're not permanent supportive housing. They're not Section 8 housing. There's nothing that's subsidized in any way, shape, or form other than the construction costs associated with it. It's affordable housing. That affordable housing can
Behind the Arkley Center?
as a matter of fact, that got traded, so we no longer are using that one. So the one behind the
Thank you.
Arkley Center, yes, is now owned by Redwood Capital. So, but just to be clear, that the folks that are going to be living there are going to, if it's very low income, depending on where it's at, a number of them is going to be 50% of the median income. That means that they're making anywhere between $26,000 to $30,000 a year. And if it's low income, it's up to 80%, which gets you into the like $46,000, $47,000 a year. So, in my interpretation, and this is mine, not the city's or anything like that, I call that workforce housing, because those people that are going to be living there are the people that serve you your bagel, the people that serve you your wine, and the same people will frequent your shops as well. So it is not any sort of transitional housing. It's not a shelter. It's none of those things. It's affordable housing.
Do all have do you work?
I do have a job, yes.
And I'd like to remind you too that actually only one of the folks up here is Only one of the folks up on the panel is actually part of city government too. The others are graciously lending us their time from other agencies around the county. Sorry, I think there was one more person too. Who, I didn't see you behind her. If we want to do one more question, I think we can squeeze that in.
Thank you all for being here. I'm a business owner in Old Town Eureka. I also was homeless from the ages of 12 and 17. Sitting here today and listening to these stories has brought back a lot of emotion for me, and that's what you're hearing right now. But I'm going to continue on with what it is that I wanted to mention. Again, I've worked with Uplift Eureka, helping one of my staff members find housing. They were very generous. They were very quick to respond. I'm very appreciative to the efforts of Eureka and what they're doing. I work with the Pathway to Payday program and doing my best within my business to offer jobs to those who otherwise would be challenged to find them. I, as an employer of over 30 years, and having employed over thousands in those 30 years, understand and have interviewed so many people and know their challenges and do my best to help with that. That being said, I'm a business owner in downtown, and that brings a lot of frustrations. And everything that you do is important, and I support it all 100%, but there is another side of this story. 2 years ago, I was leaving one of my businesses at 7 o'clock in the morning in downtown Eureka. A man came behind me yelling, "I'm gonna kill you, you effing bee." I've been here long enough, I've been in business long enough that I shrug it off. Within seconds, he was on my back, chasing me down the street. I jumped into the 101 to avoid possibly being pushed from behind him. Someone called 911. There was about a 5-minute period where this man was chasing me around the bus stops and what have you. The police came, they saw where he was, they got him. I waited the half an hour while they did what they needed to do. And then when the officer came to me, he said, laughing, and believe me, I have total respect for our police department and the job that they do. And I'm kind of shamed as a community that they have to deal what they have to. But even so, this officer said, "We know this guy. He does this all the time," kind of shrugging it off. And I said to him, I'm a female. It's 7 o'clock on a Monday morning. My life was just threatened, and I was chased onto the 101 to try to save and protect myself. And so what I want to say with that, and I do have 2 questions, maybe 3, is that, yes, everything that we're doing, that's important, but there are victims on the other side of this. And so we need that understanding as well. The victims on the other side of this also happen to be some of the businesses in Old Town, of which I am one. And I am a couple, actually. And another instance, and this is quick, is I saw and witnessed a very known homeless person in a multi-drug transaction. Somebody pulled up to his encampment, they exchanged some things, that very nice vehicle left, then another vehicle came up, they exchanged some things, that vehicle left, a motorcycle pulled up, they exchanged some things, and then that guy left. And I told this to the police, and what the police said to me was that they're very aware of this gentleman, they're very aware of his activities, but their challenges are finding or catching him, I guess, with more than his acceptable personal use of this illicit drug. One of my questions is, do those of you on the panel think that that's a fair practice? That these people who are suffering from mental illness, drug addiction, one that begets the other very often, do you think that's a really fair practice to those individuals to allow them to continue that cycle without any repercussions? Because I don't know that I agree with that. Excuse me 1 second, and I'll get to my second question. So that was a question. Hopefully that made sense. Also, I have a question because...
I do just want to be careful of time because we are technically at our
These are specific
allotment.
questions. The question is, what is the definition of camping? I often am barred from entering my own business because there are people at my doorway, and when I call the police for help, which they are very responsive and very kind, not only to those individuals, but also to myself, I get the question, are they camping? Well, they're on private property. So what is the definition of camping, and are they entitled to that on my personal property? And those are the 2 questions, and thank you for listening to me, and thank you for all the work that you do.
Thank you.
Let me jump on question 2 first. What's camping?
Yeah.
If you go onto Google City of Eureka Municipal Code 9302. That'll give you the exact definition of what camping is in the city limits of Eureka. It defines it. I worked on the municipal code with the city attorney a couple years ago with Chief Watson at the time. So it clearly defines it in there. But if people are on your doorstep and if it's private property, you can fill out a illegal lodging or trespassing letter, blanket letter, and that would be a misdemeanor in Eureka and enforceable.
And if I'm correct, those can be submitted to Eureka Police Department ahead of time from them actually trespassing so that it can be enforced on a quicker basis. Correct.
Yep. There's actually 2 forms. There's one for individuals. So you have one individual, Bob Smith, is always on your property. You can fill out for him. Or there's a blanket one that's good up to 365 days for an entire year on private property. So we fill out. A lot of them get filled out. So.
And if it's a chronic issue, you can work towards a stay away or a restraining as well. Correct?
You can, yeah.
Personal use of these illegal narcotics? Do you think it's to the benefit of those that are suffering from addiction?
I do not.
I know I can say from my own experience that when I was using interdiction by law enforcement didn't change anything ever. I was not afraid of that. I wasn't worried about it. I know that I faced prison time at times and things like that, and that didn't scare me at all. I wasn't in a state of mind where that interaction made any difference in my addiction or my subsequent behavior. I simply went back as soon as the door opened, whenever it opened, I just went back to doing what I was doing. That being said, there's a lot of medical evidence base that has shown that when people are struggling with addiction, that high level, like zero tolerance policies never actually change the amount of overdoses, crime caused by addiction, or anything else. In fact, it actually raises the value of drugs because there's a higher penalty for it. So therefore people can charge more, which incentivizes the people who are in business to sell it, for one thing, particularly the people above the level of users. For average users, with addiction, harm reduction, which means community patience, and I recognize that, the idea of working with people until they are ready to stop, they're not going to. And our prisons are full of drugs, so that's also a problem. So putting people in prison doesn't get them away from the behavior necessarily. So that's actually a totally different health topic, and it's actually about the spread of HIV and hepatitis C, and there's really specific reasons.
I want to limit audience comment at this time.
Actually, the bottom line is that we know that people who do IV drug use are going to continue to do it, whether they have clean needles or dirty needles, and then they spread diseases often sexually, not just through contaminated needle use. So when you take away needles, they'll get them somewhere, and then they'll just reuse them and share them, and then we have the spread of disease. And that's
giving them needles are also
Sir.
giving them drugs on the side, because that's happening.
So that I can't speak to, and that's a legal problem because it's illegal to sell drugs, and there's laws, and they should be enforced and supported when it comes to that.
I'll bring it back to the panel for the question that was initially presented with the idea of substances having a certain quantity of legal holding, yeah.
There is no number. If you're doing a sales case, it'd be, is it packaged? Is there money? Do they have a scale? There's no number. But Prop 47 dropped possession of methamphetamine to a misdemeanor from a felony. So back when I started as a cop, we had someone on parole or something that was causing a lot of problems, and they had a scraper bag on them. You just get enough on there, you test it, felony, boom. They're going to have a timeout for a little bit. Definitely solve some problems with some very, very problematic people. But again, the laws in California changed. The voters voted for this, and this is one of the unintended consequences, in my opinion, that we're seeing. So, but the other problem is if we have an individual who's dealing, we have to obviously have some legal authority to actually enter that person and violate their Fourth Amendment, to access their pockets and their property, to actually find it and then make the arrest on it. If we have no legal, besides doing undercover work or whatever, which we don't really have the staffing for that type of work, we have to have a legal foundation to actually violate their rights technically, lawfully, beyond challenging.
And I'd just like to add that we tried mass incarceration. It didn't work. It might be satisfying for some people to, the punishment aspect of it, but it doesn't solve the problem, and it's insanely expensive.
Well, and I think that's what Tom was getting at, is that it doesn't help. Yeah. So I appreciate the dialogue that's starting, but I do want to be conscious of time. Our panel's graciously lent us over 3.5 hours of their time today. And I want to close things out by saying thank you to our panelists. I'd also like, thank you. I'd also like to thank Department of Health and Human Services for lending us Tom Nash, but also collaborating with us on organizing this. They've been an excellent partner, and we've appreciated furthering that collaboration, as well as EPD for hanging out and lending us Commander LaFrance. I'd also like to say thank you to Providence. They initially were going to have their medical director for the ER join us, but unfortunately a scheduling conflict did come up, but they are wanting to work with us in the future, and they did help us kind of plan some of this in the beginning. So thank you to Providence as well and their collaboration. Thank you to our audience for coming in and asking such great questions and starting such a dialogue. And then to close things out, I'd like to pass things to Mayor Burgell.
Well, I just want to thank everybody for hanging in and for asking such great questions. And I appreciate the level of respect that happened here today. And I want to remind people, we were talking about, is it a choice? Is it a choice? And I can tell you this from my perspective is when I was a little kid, and I'm sure most of us when we were little kids, we don't grow up, we don't think, oh my God, my plan when I grow up is to be a heroin addict, homeless, having no family, no friends, just totally messed up, working to go to prison. That wasn't my goal, and I'm sure it wasn't many of our dreams growing up. And the thing I want to remind people is that three things. All people have value, first of all, and most importantly, all people have value. Secondly, alcoholism, homelessness, they're not moral issues. They're not moral issues. People don't do them because they're bad. People do them because they're hurting. And it's our job to work at being kind. And even a smile can make a huge impact when we're looking at people. And I just want to thank everybody for speaking today. We had a great panel. There's a lot of great work happening in our city, in our county. There's a lot more work that needs to be done. It's a community effort. We need your help. And so I'm hopeful that you'll all pick up an oar and join us. 3 months from now, we'll be having our next town hall. We'd love to see you all. And again, appreciation for all of you who hung out this Sunday afternoon. Happy Sunday.
I'd also like to just throw out a big thank you to the Mission and Open Door. Sorry I left you out on the initial one there, but thank you, Thomas, for coming in. Thank you, Kristen, for being here as well.